Oh, right.
Oh, right.
Please confirm if you can
Please
see the
confirm if you
screen
can see
clearly.
the screen clearly.
Okay.
Okay.
So this is pediatric
So this is
recall.
pediatric recall.
One session going to
One
start.
session going to
We'll
start.
have another
We'll have
like
another,
yeah.
yeah.
It's going well. Thanks to
It's going
anyone
well.
for
Thanks to anyone
asking.
for
Yeah,
asking.
getting
Yeah,
better with time.
getting
Actually, it's
better with
a
time.
I don't
Actually,
know
so
a
I don't
cough
know
that
a
has
cough that
flu is
has
going on,
flu
but
is
let's
going on.
focus. Thank you so
But
much,
let's
my dear,
focus. Thank you
asking.
so much, my dear,
Yeah.
asking.
As
Yeah,
like a sign of a
as a
good
like a
clinician,
sign of a good
actually, it's
clinician.
like
Actually,
very
it's
less
like
people in us.
very
Like
less
everyone
people in
is
it. Like
hop
everyone
on,
is
hop off
hop
sometimes.
on,
Like
hop
let's
off
go and
sometimes.
focus.
Let's go and
18-month
focus.
baby,
18-month baby.
diarrhea for 6 weeks,
Diarrhea for
stool
six
test
weeks,
is normal,
stool
and a
test is
copious amount
normal,
of
and a
watery
copious
diarrhea
amount of
now,
watery diarrhea
and there
now,
are some
and there are
undigested
some
food.
undigested food.
So any idea, any
So, any idea,
cases,
any
what
cases,
was this
what
thing is about
was this
actually?
thing is about actually?
Uh, don't forget, like we'll have
Don't forget,
another
like
theory
we'll have
class
another
on
theory
next
class
Sunday.
on next
Okay,
Sunday.
today is
Okay,
a
today
recall
is
class
a
we're doing,
recall class we're
and
doing,
next Sunday there will
and
be
next
another
Sunday
theory
there will be
class.
another theory
Yeah,
class.
that's how
Yeah,
we
that's how we
proceeding. So don't worry.
proceed. So
Coming back to this one, I
coming
think
back to
most of
this
the
one, I
people are
think
choosing
most of the
this one
people
as
are
a
choosing this one as a
lactose-free diet.
lactose-free
Now,
diet.
before going into
Now,
that one,
before
I
going into
need
that
to
one,
know
I
from you
need
guys
to know from you
what is
guys
going on your
what
mind.
is
What
going on in
type
your
of
mind.
diarrhea do
What
you
type of
think
diarrhea do you
when we
think
say like
when
a
we say
diarrhea
like
for
a diarrhea for
6 weeks? When it's
six
a diarrhea
weeks?
for
When
six
it's a
weeks,
diarrhea for 6 weeks,
what's going on in your
what's
mind?
going on in your mind?
Is it like a
Is it
infectious
like a
diarrhea? Is it
infectious
like a
diarrhea?
traveler's
Is it like a
diarrhea? Is it
traveler's
like a
diarrhea?
toddler's
Is it like a
diarrhea?
toddler's
So a lot of
diarrhea?
options are
So a lot
there.
of options are there. Or
So
you
what do you
know,
think?
so
Is it
what
a
do you
chronic
think? Is
diarrhea
it a
under that
chronic
one, or
diarrhea
is
under
it
that one,
more
or is it
convenient for
more
going for a
convenient for going for
toddler's
a
diarrhea? Now,
toddler's
if we
diarrhea? Now,
focus on that
if
one,
we
actually,
focus on that one,
this is
actually,
more
this is more
convenient for a
convenient
case of
for a case
toddler's
of
diarrhea. I
toddler's
repeat,
diarrhea.
this is
I repeat,
somewhere like
this
a
is
more
somewhere like a
convenient for a
more
case for
convenient
the
for a case for
toddler's
the
diarrhea,
toddler's
non-offensive.
diarrhea,
We don't have any
non-offensive. We don't have
particular
any
things, as you can
particular
see. We don't
things, as
have
you can
any
see. We don't
particular
have
thing
any particular thing
in relation that
in
it can
relation
be
that
anywhere
it can be
infectious or
anywhere
anything.
infectious or
We do
anything.
have point like
We do have point
undigested
like
food particle, as we
undigested food
often say.
particle, as we
To the
often
point,
say.
given
To the
undigested
point,
food
given
particle.
undigested food particle.
Also, there was
Also, there was
few key points, like
few
it's
key
a
points,
watery
like
diarrhea.
it's a
So
watery diarrhea. So
I think
I think
everyone else who has
everyone else
deal
who
with
has
toddler's
deal with
diarrhea,
toddler's diarrhea,
um, maybe
um,
we don't know that
maybe we
it's
don't know that
also watery.
it's
Actually, do
also
you
watery.
expect
Actually, do
toddler's
you
diarrhea to be
expect toddler's
bloody
diarrhea to be bloody
or
or
smelly?
smelly?
I don't think so. Actually,
I
if
don't think so.
infectious,
Actually,
then
if
can be
infectious,
smelly.
then can be smelly.
If some other
If
major
some
issues,
other
then it
major
can be
issues,
bloody.
then it can
So
be bloody.
it's
So
until proven
it's
otherwise,
until
it's
proven otherwise,
expected it's
it's
a watery
expected
diarrhea.
it's a
So this is
watery
another
diarrhea. So
point,
this is
which is
another
going
point, which
towards
is going towards
our diagnosis.
our
Let me
diagnosis.
highlight this
That
part
let me
again.
highlight this
So
part
no,
again.
no
So
obvious cause. Like
no
even
obvious cause.
overall, if
Like
you
even
see
overall, if you see
everything, you will not find
everything, you will
any
not find
obvious
any
cause. First of all,
obvious cause. First
no
of
other
all, no
illnesses.
other illnesses.
There'll
Um,
be undigested
there'll be
food
undigested
particles,
food
and then there'll
particles,
be watery
and then
diarrhea.
there'll be
Now,
watery diarrhea.
in
Now,
the management,
in
there is
the
two term I
management, there
wanted
is
to
two
highlight:
term I wanted
avoid
to highlight: avoid
lactose and avoid
lactose and avoid
this fructose thing.
this fructose
Okay,
thing.
so these are the
Okay, so
two
these are the
additional thing
two
which
additional
we
thing which
want you
we
to
want you to
highlight actually, and also the
highlight
age
actually,
group
and
one
also the
to
age group
3 year,
1 to
and the age group
3 year,
is
and
like
the
one
age
to
group is
three
like
years.
one
So
to
it's
3 years.
18 month,
So it's
one
a
to three
18
year,
month, 1 to 3 year,
diarrhea for six
a
weeks.
diarrhea
So
for
this is
6 weeks. So this is
the tricky thing. Some
that
people used
tricky
to
thing.
think
Some
this
people
can be
used to think
chronic, but
this
it's
can be
not
chronic, but it's
that
not
kind of
that kind of
chronic in kids
chronic
cases.
in
Chronic
kids
diarrhea. Now,
cases, chronic diarrhea. Now,
tell me one thing.
tell
In
me
kids
one thing: in
cases,
kids
chronic
cases,
diarrhea,
chronic
you are
diarrhea, you are
expecting in which
expecting
particular
in which
case?
particular
In
case?
kids cases,
In
if
kids
diarrhea is
cases,
bit
if diarrhea
prolonged,
is bit
there
prolonged,
is a one particular
there is a one
condition we
particular
suspect more.
condition we suspect more.
Um, okay, some people say
Okay,
celiac,
some
but
people say
celiac,
celiac, but celiac,
okay, it can
okay,
be
it
bit
can
chronic,
be
but at the
bit
same time,
chronic,
there will
but
be
at the same
pattern
time, there
of
will
the
be
diet will
pattern
be
of the diet will be
different, right? There will be
different, right? There
intolerance
will
to
be
brown. That's
intolerance to brown. That's
particularly celiac
particularly
is a question about
celiac is a question about
particular pattern of food.
particular pattern of food.
So, can we say
So,
celiac disease
can
is
we say
always
celiac disease
having
is always having
incidences like that? Not
incidences
really.
like
It's
that?
because
Not
of
really. It's
particular
because
type of
of
food
particular
when they
type of
eat,
food when they
then there
eat,
is more issues
then there
actually.
is
So
more issues actually. So it's more not like a, it's more into malabsorption. Can I add that point? that celiac is more into like a malabsorption, like a fat, and all this thing. You can put it under chronic, that's okay. But the classic one, for kids cases, with longer term diarrhea, usually we think about an Aboriginal kid and fowls maybe stool actually. So what we suspect in that case, cholera is not common in Australia, by the way. So we think about the ZRTLS. We think about the ZRTLS. If it is mentioned that alongside maybe diarrhea, there is like rectal prolapse. At the same time, there is repeated respiratory tract infection. Okay, so in that particular case, what do we think? Then we will think about the cystic fibrosis. Like, there will be also some expected respiratory association, right, guys? There is some expected respiratory association in cystic fibrosis cases. We also found celiac, we found cystic fibrosis, we found this toddler syndrome. I'm just taking the screen for 1 second. Okay. Just 1 second, guys. Just 1 second, guys. Okay, let me know if you can see this. Let me know if you can see this. So this was our question. So this was our question. As you can see, this is our question. Yes. So yes. So 1, 2, 3 here. 1, 2, 3 here. Then this that information. We are moving to the next one. We are moving to the next one. This was the highlighting nutshell. And our main thing is, avoiding lactose-free diet even recommended here. Now, quick question. Most of the diarrhea cases, would you recommend any lactose? It's a very basic question. Most of the diarrhea cases, would you recommend any sort of lactose? Not really. So it's just a consequence of that one actually. Gluten-free one, we have to pick up if it is a, celiac disease. So here we go. We're going for the next one. We're going for the next one. Then we have another question. As we can see, just a 2 year next year in a theory class, this topic would be probably will come, but it's okay. We can read it in math. Check the age. It's a 2 years actually. 2 years actually. It's a 2 years. There is fever. Korisa. Maybe this came a little bit at some point in one of the medicine class. And respiratory, there was this stridor. So this stridor, we call it as an abnormal sound. So a child's or keywords. Child plus there is abnormal sound. This is keyword. Then we have to see the severity. Severity is like a moderate. So moderate actually. Why moderate? Because respiratory muscles and this that are involved. Now question is, why not severe? If severe, vitally, bit unstable. At the same time, there will be another point. There will be wheeze or respiratory involvement will be much more. So, based on these things, what is our right diagnosis? Based on these particular things, like we do have a stridor, we do have a fever not so high, and it is like a 2 years. So it's a 6 months. So age group we can say 6 months to 6 years. Okay. So this is probably a virus because fever is not so high. It looks like a so all indicating towards a common condition, that is we call it croup. Some people say croup is fine. So we have moderate cases of croup. It will indicate just stridor, but our one is moderate because it also has a collateral muscle involvement, or question also mentioned collateral muscle involvement actually. So that's why it was into moderate. But if it is mentioned marked respiratory distress and vitals are deteriorating, then it would have been severe. Is it clear to everyone? Like how I can differentiate between a moderate case of the croup and severe case of croup. Let me show you, because this is the tricky part in the question. Most people are able to diagnose which is
But
crude.
some people
But
forget
some
whether
people
it is
forget
severe
whether
or
it is
moderate.
severe
They
or
blindly
moderate.
start
They
choosing
blindly
something.
start
So
choosing something.
this is the
So
area.
this is the
This one
area.
is that
This
particular
one is that
line
particular
where you can
line
differentiate.
where you can
These are the
differentiate.
lines where you
These are
can
the
differentiate.
lines
So
where you can
mild
differentiate. So
to
mild
like
to
moderate to
like
severe crude,
moderate to
we
severe
need
crude.
to keep
We
that
need
thing in
to
mind.
keep that thing in
Moderate to
mind.
severe crude, we need
Moderate
to
to
keep
severe
that
crude.
one
We
mind.
need to keep
So
that one in mind. So
they mention
they
stridor.
mention
It is
strider.
possible in the
It is
main exam
possible
they
in the
will be
main exam
mentioning
they will be mentioning
inspiratory stridor.
inspiratory
Okay, now
strider.
there is a
Okay, now there is
differential
a
of a
differential
stridor.
of
Can
a
anyone tell
strider.
me
Can anyone
if
tell
I
me
say
if I say
expiratory
expiratory
stridor? Okay,
strider?
this thing I will
Okay, this
discuss
thing I
again
will
on the
discuss
Sunday
again
more.
on the Sunday more.
If expiratory
If
stridor,
expiratory
it is a
strider, it is a
possibility,
possibility,
it is
it is
epiglottitis, but that
epiglottitis,
situation
but
would be
that
much more
situation would be
toxic.
much more
I
toxic.
repeat,
I repeat,
epiglottitis is one
epiglottitis
of the
is
most
one of the
toxic
most
condition.
toxic
Among
condition.
those three,
Among
there is a
those
more
three,
toxic
there is a
condition.
more toxic
Now,
condition.
in our
Now, in
this
our
particular
this
question,
particular question,
what we are
what
planning to
we
choose,
are
is it a
planning to choose,
adrenaline
is
we're
it a
choosing,
adrenaline we're
or
choosing,
would we
or
going to
would we
choose like
going
a
to choose
oral
like a
prednisone?
oral
A as an
prednisone?
answer.
A
So
as
we are
an
going to
answer. So
choose.
we are going to choose.
What do you think?
What do you think?
Now, nebulized,
Now, nebulized,
nebulized one.
nebulized
Let's go
one.
back.
I mean, let's go back.
Nebulized one.
Nebulized
Uh,
one. Uh,
it's more for the
it's
grade
more for
three.
the
So
grade
here
three.
the
So
your
here
mainstay of the
your
treatment is
mainstay of the
steroid. If
treatment is
steroid
steroid.
fails,
If
then
steroid fails,
nebulized
then
adrenaline. But if you see
nebulized
the
adrenaline. But
grade
if you see
three
the grade
from the
three
John Mutai,
from the John
then you
Mutai,
see then it
then
is
you see
nebulized
then it is
adrenaline. So
nebulized
let me go
adrenaline. So
back and
let
show
me
you
go
again.
back and show you
So
again.
here is the thing.
So here is the thing.
Yeah.
Yeah.
So here is the thing.
So here
I
is
think
the
it's the
thing. I
first
think
day
it's the
consequence
first
of the
day
classes.
consequence
No,
of the
it's still
classes. No, it's
prednisolone.
still prednisolone.
Still some cases
Still some
prednisolone.
cases
If
prednisolone.
you remember one
If you
thing,
remember one
that
thing,
there is two
that
things are
there
given
is two things are
prednisolone at the
given
same
prednisolone
time,
at the same time,
IV
IV
dexamethasone.
dexamethasone.
Is it anything
Is
like
it
this that
anything like
prednisolone
this
has
that
more
prednisolone has
efficacy or
more
less efficacy
efficacy
than
or less efficacy
dexamethasone?
than
I
dexamethasone?
agree.
I agree.
There was a level of
There was a
evidences
level of
which shows,
evidences which shows,
oral prednisolone
oral
and IV
prednisolone and IV
dexamethasone from our
dexamethasone
very first
from our very
respiratory class.
first
If anyone
respiratory
joined late,
class.
you
If
can see
anyone
that
joined
class
late, you can see
available in
that class
YouTube.
available in YouTube.
Uh,
Uh,
it's of similar
it's of
efficacy.
similar
So in
efficacy.
that case,
So in that
because it's
case,
more easy to
because it's
give
more easy to
very
give
quickly,
very quickly,
early stages,
early
it's
stages,
possible even at
it's
the
possible even at
GP
the
centers or
GP
anywhere.
centers or
A patient
anywhere.
can also
A
have
patient
this
can
drug
also have
symptoms in
this drug
collection.
symptoms in collection.
The patient's mother.
The patient's
So
mother.
with oral
So
prednisone
with
in that
oral
case, actually,
prednisone in
normally
that
they
case,
are not
actually,
supposed
normally
to
they
give
are
both
not
of them
supposed to give
together.
both of them
But I believe,
together.
but in
But I
between, I
believe,
think
but
because of
in between,
similar
I think because of
efficacy,
similar
prednisone.
efficacy, prednisone.
Okay.
Okay.
So here is the thing.
So here is the thing.
Learning these particular
Learning these
conditions.
particular
Tip.
conditions.
There's a
Tip.
tip for this
There's a
question.
tip for
Always
this
check
question.
ways in
Always
this
check
question.
ways in this
Otherwise,
question. Otherwise,
why? Because the
why?
whole scenario
Because the
can be
whole
changed.
scenario can
With
be
that same
changed.
question is
With that
wheezes
same
in the
question is
option.
wheezes in the
It will
option,
be
it will
severe
be severe
case. Clear, everyone?
case. Clear, everyone?
If
If
wheeze in the option,
wheeze in the
the
option,
whole scenario will
the
be
whole
changed.
scenario will be changed,
Or respiratory
or
major
respiratory
involvement.
major
That will be
involvement,
severe,
that will
and
be
then
severe,
answer will
and
be
then
nebulized
answer will
adrenaline.
be
Now let's
nebulized
come and
adrenaline.
see
Now
this
let's
one.
come and see this one.
Differentiate. I think
And
another day I
differentiate. I
show
think
you
another
guys
day
this
I show
table.
you guys this table.
So if you can see here,
So
this
if you
is
can
the
see here,
line
this is
for
the
the
line for
group.
the
So 6
group.
months
So
to
6 months to
so this is for the
so this
epiglottitis.
is what the
Sorry, this one is for
epiglottitis.
the
Sorry,
croup.
this one is for the
Croup is
croup.
caused by
Croup is caused
para-influenza
by
virus. So
para-influenza virus.
if
So
virus, are
if
we
virus, are
expecting
you expecting
low-grade fever or
low
high-grade
grade
fever? So
fever
you're
or high grade
expecting
fever? So you're
low-grade fever.
expecting low grade
Normal
fever.
process of croup,
Normal process of
we
croup,
found two
we
important
found two
findings:
important
inspiratory
findings:
stridor
inspiratory
and a
strider
barking cough.
and a
So
barking
sometimes
cough.
they give the
So
stridor,
sometimes they give
sometimes
the
they give the
strider,
barking
sometimes they
cough.
give the barking
So these
cough.
are the two lines
So these are
actually.
the two lines
Special two
actually.
lines for the
Special two
group
lines
to
for
be
the
remembered. But about
group
the
to be remembered.
epiglottitis,
About the
age groups are the
epiglottitis,
same.
age groups are
This
the
is
same.
also
This is also
this is caused by
this is caused
not
by
viral.
not
This one time you can
viral. This
see
one time you can see
Haemophilus influenzae
Haemophilus
bacteria. Now,
influenzae
are you
bacteria.
expecting
Now,
high
are you
fever in this
expecting high
case?
fever in this
Because
case?
Haemophilus
Because
influenzae is
Haemophilus
a
influenzae is
bacteria,
a
so we are expecting
bacteria,
high
so we are
fever.
expecting high fever.
Are we expecting this
Are we
situation to be
expecting
more
this
severe?
situation to be
Yes.
more severe?
And a key
Yes.
finding
And a key
here,
finding
inspiratory
here, inspiratory expired, here expired, restarted. Please note, sometime they might mention abnormal respiratory sound. Sometimes they don't mention stridor, they might mention abnormal respiratory sound actually. So in that case, they will give you some other clues, like the patient will be like a tripod position. So this type of patients would be like not moving, kind of like following you with the eyes, but not moving the head actually. That's like the ghost. You know, there's like a movies like Ghost does following you with eyes. So it's kind of like that. So limited head movement to protect the airway actually, and at the same time very toxic. I remember the scene of that is a very famous movie Bhul Bhulaiya, and forget about that ghost name. I think. So somewhere that ghost will look like that actually. Anyone remember that ghost name? Please mention in the comment section. Yes, that's very famous ghost actually. Yeah. So imagine that because toxic at the same time following with ice. Yes, Mom Julika, I think that's the. So imagine epiglottitis would be somewhere more like that. Toxic and following you with ice actually. Some rare cases they might tell you red cherry epiglottitis, but usually they don't give in the exam question. So treat it with the because bacterial you need a high dose of antibiotics, ceftriaxone. The last but not the least, a major difference and very easy to pick up in the question is the bronchiolitis. Okay, how? Because often given age group before 1 year, there is not like a impossible thing that in bronchiolitis can't happen after 1 year. Right? Okay, get it right. I have also seen my sister's son. He also diagnosed with respiratory syncytial virus at the age of the I think 3. Okay, and there was a bit bronchiolitis. So it's not a hard fast rule, but the predominant. But he was at the same time, even in the first year of life, he also diagnosed with bronchiolitis one time actually. Okay, so anyway, so there's a higher possibility if we see the age group of the child, there's a more chances of respiratory syncytial virus to get affected under 1 year because of obvious reason immunity is less. So less than a year, often expected in the question, and after a viral infection and everything started. So soon after a viral infection, so this thing started. There's a possibility the patient develop wheeze at some point. There's a possibility these patients develop wheeze at some point, and this also can be mild, moderate, severe. Depends on severe condition will have respiratory involvement or vital involvement, and wheeze widespread wheeze will be there actually in that case. Okay, so bronchiolitis cases, what we give, all of these cases somewhere we give oxygen, and in bronchiolitis cases we give bronchodilator and this particular case. I'll teach you the bronchiolitis more next day in the theory class. But one more very special thing about the AMC. Now, we learned in the respiratory system, anything related to respiratory, we always go for an X-ray. My question is for bronchiolitis. Is it the first line is X-ray or something else? This is a kid's case. Think and answer wisely. Okay, my question, what I'm trying to ask for bronchiolitis, very important for MC. Okay, investigation. Initial. So what is the initial investigation of bronchiolitis? Okay, so that's the question. So, according to John Murtha, X-ray is wrong answer. Very surprising. Then what is the answer? Is a throat swab. Throat swab, and what we do is a PCR, is a choice of test called. And even I saw with my sister's kid, same thing has been done with him. They didn't went for an X-ray. So nasopharyngeal swab. Yes, I think better word is a not throat, like a nasopharyngeal swab for doing the test, the PCR. So either they will tell you nasopharyngeal swab or they will tell you the PCR testing. Clear everyone for the bronchiolitis under 1 year, some respiratory involvement, there will be low grade fever. And these are the certain points to be considered. Great.
Okay, clear about the last
Okay,
question?
clear about the
Okay,
last
I
question?
think if
Okay,
it's clear,
I
now
think
we're
if it's
going for the
clear, now
next
we're
one.
going for the next one.
Now, very
Now,
interesting. I
very
want a
interesting. I
fastest
want
finger
a
first.
fastest finger
Who let's
first.
see who answer
Who let's
this
see
one.
who answer this
Like
one.
fast. Like
Like
age is
fast. Like
pregnant and
8
this
is
is cystic
pregnant and this
fibrosis.
is cystic
Okay,
fibrosis.
a bit genetic.
Okay, a bit genetic.
I will
Bit
explain more
genetic. I will
genetics next day,
explain
but
more
that's
genetics
okay.
next day, but that's okay.
Let's say this is cystic
Let's say
fibrosis
this
and
is cystic
cystic
fibrosis and
fibrosis
cystic fibrosis are
autosomal recessive
autosomal
mostly. Now,
recessive
based on
mostly.
the that
Now,
one, they're
based on the
asking the
that
next
one, they're asking the
generation
next
what will
generation
be the
what will be
consequences.
the consequences.
So it's a autosomal
So it's a
recessive
autosomal
next
recessive
generation.
next
What is the
generation. What is the
consequences?
consequences?
Now you must have
Now you must have
like heard this
like
thing
heard this thing
in SMA.
in
Sometime
SMA.
we
Sometime we
introduce this thing.
introduce this thing.
Maybe you are
Maybe
familiar
you are familiar
with this particular
with
thing.
this particular
This our
thing.
very
This our
famous,
very famous,
the bamboo thing.
the
Now
bamboo thing.
let's just
Now
come and
let's
see
just come and
what
see
just has happened.
what
Now
just has
I
happened. Now
picked
I picked
50%. Now let's come and
50%. Now
discuss
let's come
why
and discuss
you
why
just received the
you
bamboo
just
here
received the
actually.
bamboo here
Okay, so
actually.
it's a bamboo.
Okay, so it's a bamboo,
Very
like,
well designed,
very well designed
bamboo question actually.
bamboo question actually.
I found one doctor
I
very
found one
recently
doctor very
asking
recently
from a
asking
different zone.
from a
Doctor,
different
what
zone.
is bamboo
Doctor, what
actually
is
mentioned in
bamboo
the
actually
class?
mentioned in the class?
Okay,
Okay,
that's a
that's a
good
good
question. Anyways,
question. Anyways,
all right. So it's
all
just
right.
a joke
So it's just
actually.
a
Like
joke
it's
actually.
like
Like it's
what you
like
were thinking but
what you
not
were
getting,
thinking
and
but not
suddenly.
getting, and
So we
suddenly.
use a
So we use a
some sort of
some
like
sort of
word like bamboo.
word like
Different
bamboo.
country we use a
Different
different
country
thing
we
actually.
use a
We call
different thing
bash
actually.
in
We
our
call
countries.
bash in our countries.
Anyways, to understand,
Anyways, to
now coming to
understand,
this
now
one,
coming
why
to this
it's
one, why
50%?
it's 50%.
Pregnant mother diagnosed.
Pregnant
Now,
mother diagnosed.
is
Now,
this mother is a
is this
carrier?
mother is a carrier?
There is a hint I like to
There is
give
a
you.
hint I like to give
Is
you.
this mother is a
Is this mother
carrier,
is a carrier,
or is this mother is
or
a
is this mother is a
deceased?
diseased?
The mother is
The
diseased
mother is
actually.
diseased actually.
If you look into that one.
If you look into that one.
Now, normally what we
Now,
learned
normally
about
what
the
we
autosomal
learned about the
recessive,
autosomal recessive,
carrier
mother
crossed with a carrier father. Am I
carrier
right, guys?
father.
Correct
Am
me
I
if I'm
right,
wrong.
guys? Correct me if I'm wrong.
Normally carrier mother
Normally, carrier
crossed with
mother
carrier
crossed
father.
with
Now,
carrier father. Now,
let me show it to you.
let me show it to
When
you.
carrier mother
When carrier
crossed with a
mother
carrier
crossed with a
father,
carrier father,
then it is
then it is
25%.
25%.
Then actually it is
Then actually it is
25% after crossing.
25% after crossing.
But if it
But
is a cystic
if it is a
fibrosis
cystic fibrosis
and at the same
and at
time
the same
carrier
time
father,
father,
then there is a
then
sequence
there
is
is a
changing.
sequence is
Then you
changing.
can see
Then you can see
it is 25
it
and
is 25
25.
and 25.
It is 50.
It
Do
is
you want
50.
me to
Do you
draw
want
these
me to
things
draw
and
these things and
make you understand?
make you
Guys, do you
understand,
want me to
guys?
draw this
Do you
one,
want me
make you
to draw
understand?
this one, make you
Okay.
understand?
Now, see, normally
Now, see, normally x
and
x
XY.
and x
It
y.
is carrier.
It is
Okay,
carrier.
so when we are
Okay,
doing
so when
carrier,
we are doing carrier,
X.
x x.
Okay, another
Another
X, Y.
x.
So this one is a
So this one is a
carrier. This is
carrier.
normal.
This is normal.
One X. I hope you're understanding
X. I
this
hope
one.
you're
Okay.
understanding this one.
This is
Okay.
again
This is
a
again
carrier because one
a
is
carrier
separate.
because
Now
one
the
is
last
separate. Now
one
the
you
last
see
one you see
X,
x
Y.
x x y.
So
So
this is for the
this is for
regular
the
cases where
regular cases
carrier
where
mother,
carrier
carrier
mother,
father. So
carrier
can we
father.
say
So can we say
25% because
25%?
1, 2, 3,
Because
4.
1, 2, 3,
One
4.
of the four
One of the
means
four
25%
means
correct. Up to
25%
this one,
correct.
it is
Up to
it
this
clear
one,
to
it
everyone?
is it clear to
Okay, now
everyone?
coming the
Okay,
abnormal
now coming the abnormal one.
X,
X,
and
X,
Y.
and X,
So
Y.
the mother is diseased.
So the mother is diseased.
Right? So the mother is
So
diseased
the mother is diseased
and the father is carrier.
and the
Now
father is
let's
carrier.
cross.
Now let's cross.
Now X,
Now X,
X. Okay. So
X.
this is
Okay.
carrier.
So this is carrier.
Then another one.
Then another one.
X,
X,
Y.
Y.
Okay. So this one
Okay.
is
So this one
disease.
is disease.
Another one is
Another one is
X
X
and X.
and X.
I'm just calculating.
I'm
You
just
can do the
calculating. You
calculations.
can do the calculations.
Another one is
Another one is
another X.
another
Another
X.
Y.
Another
Now
Y.
you can see
Now you can
two
see
digits. So
two
25
digits. So
and
25
25,
and
50.
25,
Now clear
50.
everyone?
Now clear
So
everyone?
we just draw
So
it
we just
and
draw it
crossing
and
with all
crossing
of
with
them.
all of
Yes.
them. Yes.
If
If pattern, see if pattern will normal, nothing will happen. Actually, you don't have to worry. Is it a question? Like normally, think in that way. It's a good, alhamdulillah, then actually would say. If father is normal, there's nothing to worry. That is something, that's why, genetic testing we do. That's why it's very important. Nowadays, it is mentioned before, even marriages and this, that. Have you heard about this thing that pre-marital test? Have you ever? Nowadays, I have seen also packages by some companies actually, like a pre-marital test. And in this pre-marital test, there are certain tests like thalassemia, this, that are involved. Because if both are carrier, it means the higher chances that one of the baby could be affected. Clear? It is made based on that actually. Yeah. Great. All right. Okay. Next question. A baby 6 weeks and flat. This is a question related to baby's head position. Okay. It's an unusual question. I found this question tested 5 years back, and again I found this question tested last year actually. Baby is 6 weeks old and flat on the back of the head. Mother is concerned about this. Head circumference is normal. Now, my question is head circumference can be increased in one particular case. So there will be also questions in MC regarding that. Always check in the question. Head circumference in a certain circumference can be increased in hydrocephalus cases. Okay, whatever it is, mothers consider this head sum is normal, so we are a bit concerned that it is not hypothalamus. No intellectual abnormalities are present. So it's not a neurological or intellectual problem. So optimists advice for the one. So it is looks more like a mechanical problem. That maybe baby's head position, maybe some other way it has changed. Okay, or maybe oversleeping can cause it, or sleeping in a cot. Cot is like a bed for the babies, like there's like maybe they have their own bed, and it's like a cot, like a jail. So sometimes their head just goes in one particular side, and they just sleep onto that one. Now, what do you think? What is the right answer here? Make the baby sleep in a pongo. Assure it will resolve actually. Which one is a better answer? So many are choosing B as a correct answer actually. Now let's find it out the reference. This is a little controversial question actually. Now here is a line I like to show you guys. There's a also helmet thing. Encourage time in prone position while awake. We have to come back. Make the baby sleep in prone position. Is it the same line? Make the baby sleep in prone position. Encourage time in the prone position while awake. Total different thing. Make the baby sleep in a prone position while sleeping can be very dangerous. Asphyxia can happen, and at the same time, even baby can be dead because of that. Rare cases. Asphyxia can happen. So while sleeping, we don't encourage that one. So our final answer, yeah, sideways is fine. Sideways is fine. Yes. But not in a prone position. So assure her it will resolve. The reassurance at this point is important actually. Okay. So reassurance in these cases. So then regularly changing the sides and encouraging sleeping in prone position. Now, with the same question, I'm just trying to change something. Make the baby sleep in prone position while awake. Now, what do you think? What is the right answer? Then my right answer would be A. So do you understand? Like a simple word change can totally make a question faulty or correct actually. So for our case here, our answer is B. But in the main exam, if you find that appropriate line, make the baby sleep in prone position while
That
awake.
is the more better
That is the
answer
more better
than
answer
even the
than even the
reassurance. Rather than
reassurance.
reassurance,
Rather
if you
than
can
reassurance, if
suggest
you can
something,
suggest
that is
something,
even more better.
that is even
Is
more
this
better.
question is clear,
Is this
everyone?
question
We're
is clear,
choosing
everyone?
B,
We're
but it
choosing
can
B,
be A
but it can
in the
be
main
A
exam if
in the
while
main
awake,
exam if while awake,
this line is
if this
mentioned.
line is mentioned.
Okay. Now here
Okay.
is a nutshell.
Now here is a
Babies
nutshell.
sleep
Babies sleep,
often sleep in a cot.
often sleep in a cot.
So
So
rapidly changing
rapidly
head position
changing
is
head position is
necessary actually.
necessary
Okay,
actually.
and you can go
Okay,
for a
and you can go
reassurance,
for a
and more
reassurance,
further
and
advice
more
can be.
further advice can be.
You can also
You can
encourage
also encourage
like
uh,
a
like a
to be in the prone
to
position
be in the
while
prone
awake.
position while awake.
Yes, and
Yes,
not in sleep.
and not in sleep.
We're okay with right
We're
last
okay
question,
with
right?
right last question,
Yes.
right?
So our answer is a
Yes.
B.
So our
We're
answer
going
is a
for
B.
an option
We're
number
going
five.
for an option number
We
5.
learned about the
We
jaundice,
learned about the
remember about the
jaundice, remember
congenital
about the
hyperbilirubinemia,
congenital
physiological
hyperbilirubinemia,
jaundices. Now here
physiological
is a
jaundices. Now
neonatal
here is a neonatal
jaundice-related
jaundice-related
question, like a jaundice baby,
question, like a
second day of
jaundice
the
baby,
birth, not
second day of
first
the
day.
birth, not first day.
Weight gain is normal
Weight gain
since
is
then,
normal
and
since then,
up to
and
6 week,
up to
the
6 week,
jaundice.
the
I think
jaundice.
I remember I
I think I
mentioned
remember
about
I mentioned
this
about
spatial light.
this spatial light.
One particular
One
jaundice
particular
can to
jaundice
stay
can
up
to
to
stay up to
6 weeks.
6 weeks.
What do you think? What is
What do
the
you think? What is the
right answer in this
right
case?
answer in this case?
I think technically both
I
of
think
them
technically
are
both of them are
correct answer.
correct answer.
Physiological jaundice or breast
Physiological
milk
jaundice or
jaundice,
breast milk
because it's the
jaundice,
second day.
because it's the second day.
But as
But
per the
as per the
definitions and this that,
definitions and this that,
which one is going more
which one is
towards?
going more
So because it is
towards?
more
So because it is
specific,
more
it
specific,
is more
it
specific
is more
towards the like
specific
a
towards the like a
breast milk is a more
breast milk is a more
appropriate term. Easily
appropriate
we
term.
learn the
Easily we
differences,
learn the
the breast
differences,
milk and the
the breast
breast
milk and the breast
feeding jaundice, because
feeding
only
jaundice, because
breast
only
physiological
breast
jaundice,
physiological
it's a
jaundice,
broad term,
it's a
but
broad
we have the
term, but we
specific
have the
things now.
specific
Now,
things now.
first let me show
Now,
you the
first let me
nutshell,
show you the
so that
nutshell,
those of you
so
don't
that those of you don't
still the idea is not
still
clear.
the
Let's
idea is
try to
not
clear.
clear.
So in
Let's try to
nutshell,
clear. So in
breast
nutshell,
milk jaundice
breast milk jaundice
rises long term
rises
after
long
day
term
one.
after
So
day one.
normally
So
it's from
normally
the day
it's from
two.
the day 2 or
Suspend breastfeeding for
suspend
1 to 2 days.
breastfeeding for one to
That's
two
a
days.
possibility.
That's a possibility.
Okay.
Okay,
That's one of the thing.
that's one
But
of
we
the
don't
thing.
really
But
stop
we
it
don't really
actually.
stop it actually.
More information.
More information.
So it can also be
So
let's
it can
start
also be
and this
let's
that.
start and this that.
And they
And
also mention
they
a few
also
lines here.
mention few
If you
lines here.
can
If
see
you
here
can see here
that
that
it's a
see
possibility
it's a
like
possibility like
day 14
day
slowly
14
or
slowly, or
breast milk can be
breast milk can be
jaundice can be normal
jaundice
even
can be
in between
normal
four
even in
weeks
between
to
4 weeks to
12 weeks. This is a
12
special
weeks.
line.
This is a special
So
line.
4 weeks will
So
bring, but
4 weeks
normally
will be,
when
but normally when
started from the day 2 or
started
day
from the
3 or
day
day
2 or
4,
day 3 or day 4,
most cases from the
most cases from the
second week
second week
started to decline, but
started to
please keep
decline.
it in
But
mind it
please
can
keep
be
it in mind,
extended
it
up
can be
to
extended up to
even 6 weeks.
even 6 weeks.
Actually, there is a line in the
Actually,
books
there
I
is a
found
line in
in
the
past.
books I found in
Okay, but
past.
here it is
Okay,
mentioned
but here
even
it is mentioned
up to
even
12 weeks, it
up
can
to
be
12
even
weeks, it can be even
normal and possible to
normal
breast
and
milk jaundice.
possible
So
to
if
breast
we
milk
come back
jaundice.
to our
So if we
question
come
again,
back to our question again,
yeah. So this was the
yeah. So
question.
this was
I
the
think it is
question.
more
I think
appropriate
it is
with
more
the
appropriate with
breast
the
milk jaundice.
breast milk
Even though
jaundice.
physiological
Even though
jaundice is not a
physiological
wrong
jaundice
answer,
is
I
not
would
a
say
wrong
actually.
answer,
But
I would say actually. But
since we are
since we
looking for
are
the more
looking for
specific
the more
names, so
specific
breast milk
names,
jaundice
so
is
breast
the
milk jaundice
answer.
is the answer.
Breast milk jaundice also
Breast
comes
milk
under
jaundice
the
also comes
physiological
under the
jaundice.
physiological jaundice.
Okay.
Okay.
Okay, someone asked you why not
Okay. Someone else you
breastfeeding
want a
jaundice. I mean, for
breastfeeding
this
jaundice.
one
I
we
mean, for
discussed,
this
I
one
think
we
last day,
discussed, I think last
they
day.
will tell you about
They
the
will tell you
technical
about the
problem.
technical
So
problem.
breastfeeding job
So
is
breastfeeding
like
job
a technical,
is
like
like
a
a technical,
feeding
like a feeding
technique related problem
technique
actually,
related problem
not like
actually,
a
not like a
actual big
actual
issues and this
big
that
issues
actually.
and this that actually,
Right. So those
right?
kind of things they
So
will
those kind
mention
of
that
things they will mention that
trying to feed the
trying
baby
to feed the
and you
baby,
also
and
observe
you also observe
the the
the
patient cannot
the
feed the baby
patient cannot
properly.
feed the
So
baby
it's more like a
properly.
technical
So it's more
problem.
like a technical problem.
Uh, quick
Uh,
question.
quick
Any
question:
problem with breast
any
milk?
problem with breast milk?
Any problem with the
Any
breast
problem
milk
with the
in
breast milk in
breastfeeding jaundice?
breastfeeding
Quick
jaundice?
question.
A quick question.
Answer. There
Answer:
is no
there
problem
is
with
no
the
problem with the
breast milk in the breastfeeding
breast milk in the
jaundice.
breastfeeding jaundice.
So make sure
So make
the
sure
hydration is
the
needed.
hydration
All
is
of the
needed.
cases it
All
is
of the cases it
important.
is important.
Hydrations are
Hydrations
maintained actually.
are
Let's come back
maintained
to the
actually.
next
Let's
one.
come back to the next one.
A title is
A
given child
title
with
is
feeding
given
problem
child
this
with
time.
feeding problem this time.
Previously 3 months,
Previously
weak
3 months,
child, I think
weak
from our
child,
first
I think from
lecture.
our first
The
lecture.
infant is suddenly
The infant
vomits a
is suddenly
large part of
vomits a
his
large
tail
part of his tail
after feeding.
after
Physical
feeding.
examination reveals
Physical
no
examination reveals
abnormality,
no
means no
abnormality, means
mass.
no
Okay, always
mass.
remember
Okay,
physical
always remember physical
abnormality showing
abnormality
no
showing
finding means
no finding means
um,
um,
those diseases
those
finding you can
diseases
omit them.
finding you can omit
Proper
them.
procedure would
Proper
be
procedure would
okay.
be
Now what do you think?
okay. Now what do you think?
So child with
So
vomiting.
child
So
with
this is a case
vomiting. So
related
this is a
to
case related to
child
child
plus vomiting.
plus vomiting.
And this child is an
And this child is
infant.
an infant.
Some people are up to
Some people are up
also
to
change the milk
also change the
formula.
milk formula.
Okay, suddenly
Okay,
these moments, let me
suddenly these
correct one
moments,
thing.
let me correct one thing.
These vomiting
These vomitings are
repeated.
repeated.
I mean,
I mean,
3 weeks back he
3
was
weeks
normal.
back he was normal.
Back okay.
That okay.
Now repeated
Now
vomiting.
repeated vomiting.
Previously normal child.
Previously normal child.
And now what
And
started?
now what
I
started?
think the
I
lines
think
are
the
not
lines
organized
are not
properly. Then
organized
think
properly.
about it
Then think about
and then
it
answer.
and then answer.
Should we perform a
Should we
test? Should
perform a
we
test? Should we
think about just
think about
monitoring the
just
growth?
monitoring the growth?
Okay.
Okay.
Let me
Um,
ask one thing. Is
Let me
it
ask one
possible
thing.
by
Is
any
it
chance it
possible
can be
by any chance it
CERD?
can be ZERD?
Okay, when you're saying
Okay, when you're
it's
saying
quite possible.
it's quite possible.
Very important, someone
Very
mentioning can
important,
it be
someone
parallel
mentioning can it
dystrophy
be
review?
pyelodystosis
Physical
review. Physical
examination reveals no
examination reveals
abnormality,
no
means
abnormality,
no
means
mass
no
or
mass
no
or no
peristalsis. When they
peristalsis.
say it like that,
When they say it like that,
PS is
PS
out.
is
Clear?
out. Clear?
PS is out. So
PS
this
is
is the
out.
thing.
So this
Now,
is the
if we
thing.
think about the
Now, if we think
ZERD,
about the
is
ZERD,
it possible that
is it possible that
you
um,
know
you know
add thickener to the
add
milk? Our
thickener to the
parents,
milk? Our
grandparents,
parents,
they also used to
grandparents,
do this
they
kind
also
of
used to do this kind of
old technique actually.
old technique actually.
And here is the thing:
And here is the thing:
GRD,
GRD
can vomit a large
can vomit a large
part of his feet after
part of
food.
his
Yeah,
feet
that's
after
quite
food. Yeah,
possible.
that's quite possible.
And
And
milk flows freely
milk
from the mouth
flows
soon
freely from
after
the mouth soon after
feeding. This is
feeding.
also important.
This is also important.
And this is a
And
very
this
old
is a
technique
very
used by
old
our
technique used
parents,
by our
grandparents,
parents,
that adding
grandparents,
thickener to
that
the
adding
milk,
thickener to the milk,
making it more
making
thicker,
it more thicker,
less chances of
less
vomiting.
chances of
There's
vomiting.
another option if
Is
you can
another option
remember.
if you can remember.
It's also available
It's
in the
also
pharmacies
available in
like
the pharmacies, like
Gaviscol actually.
Gaviscol actually.
Yeah. So
Yeah.
Gaviscol is
So
important.
Gaviscol
So
is
final
important. So
summary, the
final
diagnosis
summary,
is
the diagnosis is
CERD. If it
CERD.
usually would be
If it
mentioned
usually will
repeated
be mentioned repeated
vomiting, not a single
vomiting.
episode
Not
of
a single
vomiting, I think
episode
we
of
will just
vomiting, I
observe.
think we will
Let
just
me
observe.
clarify this
Let
question.
me
If it
clarify
is
this
in the
question.
main
If it is
question
in the
only
main question
mention
only
single
mention
episode of
single
vomiting and
episode
result,
of
then we
vomiting
can
and
just
result, then
observe
we
because
can
it
just
is nothing
observe because
probably.
it is
Just
nothing probably.
maintaining the
Just
hydration is
maintaining the
important.
hydration is important.
But if they said like
But if they
repeated this
said
thing
like
is
repeated
happening,
this thing is happening,
it's a possibility to
it's a
CZERD.
possibility to ZERD.
Of course, we need to exclude
Of
the
course, we need to
PS
exclude the PS
by physical
by
examination.
physical
So since
examination.
no mass, no
Since no
peristalsis,
mass, no
this is
peristalsis, this is
ZERD.
ZERD.
So adding thickener to
So
the
adding thickener to
milk.
the
Adding thickener to
adding
the milk.
thickener to
They
the
can
milk.
also give you this
They can
line
also
milk
give you
flows
this
freely
line:
from the
milk
mouth.
flows freely from
This
the
can
mouth.
be also
This can
another
be also
special
another
line.
spatial line.
Okay.
Okay.
Ready? Next question.
Ready?
Two-year
Next
child with
question.
umbilical
2 year child with
hernia.
umbilical hernia.
Irritable parents.
Irritable
Parents are
parents.
concerned.
Parents are
So what to do
concerned.
in that
So what to
case?
do in that case?
The parents are concerned.
The parents are concerned.
Child is having
Child is
umbilical
having
hernia
umbilical hernia,
and child is
and
irritable, not
child
really
is
the
irritable,
parents.
not really the
Parents are
parents.
concerning
Parents
like
are
what to
concerning
do.
like what to do.
Okay,
Okay,
we do have a issue
we do have a issue
that is
that is
umbilical hernia.
umbilical hernia.
Okay,
Okay,
quick thing.
quick thing.
Is it possible
Is it possible
irritable child
irritable child
is a red flag?
is a red flag?
And you can Google it,
And you can Google
or
it,
you can check some
or
things,
you can
or
check
it will
some things,
come
or
in the
it will
next day.
come in the next day.
No, it's
No, no, it's
the comments here. I'm
the
sorry.
comments here. I'm sorry.
Yeah, I'm been
Yeah,
no,
I'm in,
no,
no,
it's not
no,
irritable
no, it's
parent, but
not
yeah.
irritable parent, but
Sorry
yeah.
about the workplace
Sorry about the
actually.
workplace, actually.
Okay, that's why I
Okay,
mentioned in the
that's why I
beginning.
mentioned in the beginning, like
2 years child who is
2 years
having
child
umbilical
who is
hernia,
having
and the
umbilical
child is
hernia and the
irritable,
child is
and
irritable
parents are
and
concerned
parents are
actually
concerned
in that
actually
case. So
in that case.
this
So
is a case about
this is
the.
a case
I'm
about
really
the.
sorry.
I'm really
This is
sorry.
how the
This is how
nowadays the news media
nowadays the
works.
news media
They will
works.
take just
They
one
will
line
take
from
just
you.
one line from you.
Okay,
Okay,
you said
you
something
said
which
something
probably you didn't
which
mean,
probably you
and
didn't
that's how
mean,
the news
and
media
that's how
take
the
that
news media
particular
take that
portion actually.
particular portion
So
actually.
this is how
So
today also
this is
happened.
how today also
It's not
happened.
the
It's not
irritable
the
child.
irritable
It's
child.
not the irritable parents,
It's
the
not the
irritable
irritable
child
parents, the
actually.
irritable child
Okay,
actually.
misplaced by
Okay,
comma,
misplaced
yes.
by
So
comma,
2 year
yes.
child, and
So 2 year
sometimes we
child,
just
sometimes
bring
we
the
just
raw
bring
recalls.
the raw
So the
recalls.
raw
So the
recall
raw
is
recall
just a
is just
a funny
a
thing.
funny thing.
Sometimes I mention this
Sometimes
thing
I
that
mention this thing
recallers
that
are often
recallers are often,
agitated
agitated
and psychotic. I
and
keep
psychotic.
saying
I
this thing.
keep
Okay, let me
saying
tell
this
you
thing. Okay,
how.
let me tell you
Now, when
how. Now,
I was
when
going through
I
the
was going
exam,
through the
and
exam,
let me tell you an
and let me
interesting
tell you an
story.
interesting
I think it will
story.
be very
I
useful
think it
for
will
me
be
and
very
more to
useful
you in
for me
coming
more
days.
to you in coming days.
Now,
Now,
um,
um,
we of course we
of
make
course,
groups.
we
Everyone make
make
groups
groups.
before
Everyone make
exam.
groups before
So we were
exam.
three friends.
So
We
we
were
were three friends who
discussing
were
in online.
discussing in
We
online.
said like, okay,
We
we
said
will
like,
take
okay,
our
we will
exam
take our exam
the last day.
the
Okay,
last day.
so
Okay, so
I made this
I
plan.
made this
So
plan.
bro, what's
So
the
bro,
deal
what's
here?
the
The deal is
deal
like,
here? The deal is like,
what if we can
what
do? We
if we
can
can do? We can
try collecting,
try collecting,
more
more
suggestions or topics from the
suggestions of topics
friends.
from the friends.
That time, recall
That time,
collection.
recall collection.
Um,
Um,
People also used to give more
People also used to
recalls,
give
maybe
more recalls,
sometimes.
maybe
Nowadays,
sometimes.
people don't want to
Nowadays,
think
people
much,
don't
but
want
rather
to think
expect
much,
even
but rather
more,
expect
actually.
even more, actually.
But that's okay.
But that's
Uh,
okay.
anyway, so
Anyway, so
we make a list,
we
okay?
make a
We are
list,
taking the
okay? We are
exam. I
taking the
remember my
exam. I
exam date
remember my
was
exam date was
19th April, but exam
19th April,
starting
but
on
exam
the
starting on the
13th, actually.
13th, actually.
Okay, so listen to
Okay,
this part
so
carefully
listen to this
because
part
this can
carefully
be,
because this can be,
useful to many of you.
useful to many of you.
Um,
Um,
so,
so,
um, so
um,
my
so
exam was 19
my
to
exam
13,
was 19
14,
to 13,
15,
14,
16,
15, 16,
17, 18,
17,
so
18,
19.
so 19.
Okay.
Okay.
So in this
So
case,
in this case,
this was the exam
this
date,
was the exam date,
and so we
and
targeted
so we targeted
many candidates
many
like this. Actually,
candidates like this.
we
Actually,
keep
we
good
keep
relation, and
good
we
relation,
give them a
and
name,
we give them a
like
name,
a
like a
chicken.
chicken.
Okay, so
Okay,
the
so
people
the people
before us were
before
our chickens,
us
and
were
we're
our
going to eat.
chickens, and we're going to eat. You know,
So it's kind of
so
like
it's
that
kind of
actually. I mean,
like
we
that
love
actually.
eating
I mean,
chicken.
we
That's why
love
we
eating
give the
chicken.
name
That's why we
actually,
give the name
like that.
actually, like
Uh,
that.
the
Uh,
aim was to
the
collect
aim
people
was to
from them.
collect
We
people from
also
them.
were
We also
helping them.
were helping them.
So we make a
So we
group
make
like
a
a one
group
month,
like
one and
a
a half
one
month
month,
track,
1.5 month track,
and we were
and
discussing
we
all of
were
them.
discussing all of
And of
them.
course, my
And
performance
of
was a
course,
little
my
bit
performance
better
was a little bit
in
better
terms of because I was
in terms of
been
because I
event
was
teacher
been
before
event
coming
teacher
to MC.
before coming to
So this is a
MC.
bit more
So this is a
organized.
bit more
So
organized.
some people used to trust,
So
and
some people
they
used to
also used to
trust, and
show their
they also used
recall
to show their
that
recall,
hey, what's the
like, hey,
explanation of
what's the
this that.
explanation of this
Okay,
that?
so based on that one,
Okay,
we
so
said
based on that
like
one, we
see
said
help
it like
learning
see
all our
help
bilateral
learning all our
things.
bilateral things.
So
So
these particular
these
days,
particular days,
when they had their
when
exam,
they
because I
had their
had the good
exam, because I had the
communication and
good
this that, and also
communication
so
and this
as
that, and
my
also so as
the other
my
friends. One
the
was
other
from
friends,
Pakistan,
one
one was
was
from
from
India.
Pakistan, one was from
So we
India.
managed to get
So we
like
managed to
so
get
many
like
files.
so many
Okay,
files.
I mean,
Okay, I mean,
and it's not like that
and it's not like that
everything we're solving at the
everything we're
last. They say
solving at the
14
last,
file is
say
coming up.
14
We are
file
also
is coming up.
helping.
We are also
Okay, this
helping.
is came, this
Okay,
thing
this
came,
is
this can
came,
be
this
answered,
thing came,
DD
this
like
can be
that.
answered, DD like that.
Yeah, so 15 they
Yeah,
also
so
got help,
15 they also
16.
got help,
And
16.
finally,
And
because our
finally,
exam was at the
because our
end,
exam was at
so
the
we
end,
got the
so
maximum
we got
help
the maximum help
actually. Okay.
actually. Okay. So we actually got the maximum help actually at the end. So my suggestion, this is a like a kind of like a chicken story. So you can also do that. At the end you can make groups, and of course there will be batchmates, but there will be also a lot of other MC candidates, isn't it? So you guys try choose the last day or last 2 days, and nowadays we also conduct classes. That time it was things are different. Now we also conduct classes in between these things. Try collect um, recalls. How do we find? Very simple. You go to the guideline group and post it that you are making a group. Is there any November candidate? Is there any February candidate? One to one before your exam, you can post things like that. So many will be responding into that. Okay, so that's how you get attention, and you pretend yourself like you are really up to discussing things actually, and you also do that. As I mentioned, learning is a bilateral, so you also keep posting. Tell me one thing: is there any quota system in MC that okay, these 100 people will pass everyone? Is there anything like that? No, right? So whoever possible or get that particular number will pass the exam. That's the deal. So it's not harm if you also help some people, or some people get a little help from you, from your ideas and things like that. Okay, so this is something you need to work on or keep that one in mind. Okay. So I hope you like that chicken story, as which you mentioned. We just give them a name actually. Of our okay, Mr. Bogdadi, his exam on that day. He's in a so bro. Chicken day five, we were using code words. Bro, chicken day five send me questions actually. So we used to make our own funs actually that particular time. Okay, coming back to this question, it's a ZERT question, and in this this was the umbilical hernia question, and in this umbilical hernia question, we picked this one referred to emergency. Why? In case of umbilical hernia, if the kids become irritable, it is possible the hernia can be an issue. Is it possible hernia can be strangulated? Some cases, so small kid they cannot tell you much things, but irritable child is a red flag. So irritable child is a red flag. So probably strangulated. So probably strangulated. I hope that's clear to all of you. So you can see one thing. This is kind of like a page related to pediatric. You'll find it in your John Muttag as well. Next day there will be. So in that particular you can see a lot of cases you will see. When some of the hernias, I think they also recommended to do it ASAP. So many hernias, we should not keep it for so long time. Or another thing, any of the hernias, it's a possibility that they can strangulate. Okay, so based on that one, and if the kid is irritable and having hernia, means higher chances there is something wrong with this kid. Right? All right. Yeah, you can see there we do have a pediatric surgery small note. Based on this page, you can have a look on that. We can move to the next one. So we got taking a little bit more time on this. Mother comes with a 12-month infant. With a this time increased head size. Last time we found head size was not increased. This time head size increased. From 25th up to 75th. So it's quite a big. We already I think decided last time if head size increased what it would be. But we do have another sign. Hypotonic condition. So hypotonia, head size changing, whatever it is, what you like to do next. What would I like to do next in this case? So many are into CT scan of the head. Okay. Now, in this condition, I will answer based on the final answer is a D. Ultrasound actually based on the handbook. Based on the handbook, The answer is a
ultrasound actually.
ultrasound
Ultrasound
actually.
will help you
Ultrasound will
detecting
help
the,
you detecting the
that
that
particular
particular
hydrocephalus situations.
hydrocephalus situations.
Whereas,
Whereas
mm,
mm, taking 1 second.
did I put the
Did I put
pediatrics
the
handbook
pediatrics
question
handbook
numbers?
question numbers?
Not it.
Not it.
Okay, let me just take
Okay,
a
let me
second.
just take a second.
Okay, got it.
Okay, got it.
Okay, posted guys.
Okay, posted guys.
So this one,
So
this
this one,
particular case, I
this
think
particular
we
case, I
think
think we think
um, to
um,
go with a
to go with a
ultrasound to rule out
ultrasound to rule out
hydrocephalus because the main
hydrocephalus
concern is
because the
the
main
head size
concern is the
change.
head
Okay, is
size
this
change.
question is
Okay,
clear,
is this
everyone?
question is clear,
Head
everyone?
size change.
Head
So we
size
want to do the
change. So
ultrasound
we want to
first,
do the
like more
ultrasound
easy
first, like
convey,
more easy
rule out
convenient.
if it is
Rule out if it
underlying
is
hydrocephalus.
underlying
Then we'll think
hydrocephalus.
about
Then we'll think about
ruling out the
ruling out the
hypotonia because of the
hypotonia
TSH
because
and
of the
this that. But head
TSH and
size
this that.
change
But
is
head
the
size change is
primary
the
complaint. Head size
primary
change is
complaint.
the
Head size change is the
primary complaint here.
primary complaint here.
Okay.
Okay.
Interesting next question.
Interesting
Child
next
after
question. Child
a
after a
infection, cold sore,
infection,
develop
cold sore, develop
lesion on the trunk, some
lesion on the
rashes, and
trunk,
those
some
are
rashes, and
non-blanchable.
those
So
are
this is a
non-blanchable. So this is a
interesting case,
interesting case,
non-blanchable rash, and we
non-blanchable
do have
rash,
some
and
labs
we
are
do have
given.
some labs are given.
Okay. So based on
Okay.
these
So
things,
based on these
which one do you
things,
think is
which one
the
do you think is
right
the
answer?
right
Keynote,
answer?
there is no
Keynote, there is no
internal or external
internal or
bleeding.
external
So what is the
bleeding.
next
What
step
is
in the
the next
management?
step in the management?
Okay. Can anyone
Okay,
tell me
can anyone tell
non-blanchable
me
this
non-blanchable
particular
this
rash?
particular rash?
And we do have some lab
And we do have
findings.
some lab findings.
As you can see,
As you can
I
see,
can see the platelet
I
is
can
a
see the
bit
platelet is
down.
bit down,
So low
so
platelet.
low platelet.
So what do you think about
So
this
what do you
particular
think about this
situation?
particular
Thrombocytopenia,
situation?
okay.
Thrombocytopenia,
But
okay.
thrombocytopenia is a
But
big term. I
thrombocytopenia is a
mean,
big
under
term. I
this
mean,
umbrella,
under
there's so
this
many other
umbrella, there's
things.
so many other
So
things.
this one is going
So
more
this
towards
one
the,
is going more towards
you
the,
know,
you know,
immune or idiopathic
immune or
thrombocytopenic
idiopathic
pulmonary fever,
thrombocytopenic
which is
pulmonary
very
fever,
common
which
after
is
a
very
viral
common
infection,
after a
as like
viral
our
infection,
case.
as
If
like
you go
our
back to
case.
our
If you
case,
go
you will
back
see
to
the
our
same
case, you
thing.
will see the
So
same
there
thing.
is
So there
after a
is
cold sore,
after a
there was
cold
an
sore,
infection,
so
and
there
after
was an
that this
infection,
thing
and after
started.
that
Very
this thing
classic
started. Very classic
idiopathic thrombocytopenic
idiopathic
part fever.
thrombocytopenic part
Now,
fever.
observation like
Now,
the
observation
platelet
like
count
the
and
platelet
treatment is
count and
based on the
treatment
platelet
is
count.
based on the platelet
Treatment
count.
can be observation,
Treatment can be
treatment can be
observation, treatment
corticosteroid,
can be
treatment can be
corticosteroid, treatment can be
IVIG. I repeat,
IVIG. I repeat,
ITP cases, treatment
ITP
can
cases,
be
treatment can be
observership,
observership,
observation,
observation,
corticosteroid, IVIG.
corticosteroid,
Now, let's come and
IVIG.
see
Now,
in
let's
which
come and see
cases
in which cases
observation, which cases
observation, which
corticosteroid, which is
cases
IVIG.
corticosteroid,
Now,
which is IVIG.
in a
Now,
patient with a
in
platelet
a
count
patient
more
with a
than
platelet count more
30,000,
than
no bleeding,
30,000, no
you don't
bleeding,
need to do
you
anything
don't need to
actually.
do anything
You
actually.
don't need to do
You
anything.
don't
Now
need
let's
to
come
do
and see
anything.
in
Now
our
let's come
case.
and see in our
This
case.
case has a
This case has a
platelet count is
platelet
over
count is over
30,000. So
30,000.
this is
So this
35,000.
is
Now
35,000. Now,
another thing,
another thing,
medical treatment
medical
required
treatment
if
required
less than
if less than
30,000,
30,000,
and another case is
and
a
another case is a
30,000.
30,000.
If
So
less than
if
30,000
less than
corticosteroid
30,000 corticosteroid
and IVIG. Now,
and
IVIG
IVIG.
is the
Now,
answer if
IVIG
there
is
is
the
a
answer if there is any
contraindication to
contraindication to
corticosteroid. So,
corticosteroid.
otherwise,
So
more than
otherwise,
30,000
more than
observation, less
30,000
than
observation, less
30,000
than
steroid.
30,000
Is it clear to
steroid.
everyone?
Is it
So,
clear to
coming back to
everyone?
our
So
question, this
coming
is
back to our question, this
35,000.
is 35,000.
Okay, so we
Okay,
will just go
so
for
we
the
will just go for
observation.
the
Best possible
observation.
answer is
Best
a
possible answer
bed
is a
rest C.
bed rest
Good?
C. Good? Good.
Wonderful.
Wonderful.
Okay, 12-year-old
Okay,
child's mother
12-year-old
says her
child's
daughter
mother
is
says her
recently
daughter is
making
recently
complaints
making
of headache,
complaints of
having
headache,
pain, nausea
having
when
pain,
she is about
nausea
to
when
go to
she is
school.
about to go to
She's
school.
the youngest of the
She's
three
the youngest
siblings.
of the three siblings.
Her school teacher says that
Her
she's
school
a
teacher
good
says
student
that
at the
she's a
school,
good
but she does
student
not
at the
want to
school,
leave
but
the
she does
mother.
not want to leave the mother.
And the mother is recently
And the mother
diagnosed.
is
So,
recently
summarize the
diagnosed.
mother
So,
is diagnosed
summarize the
with the
mother is
cancer,
diagnosed with the
and
cancer,
for that reason, that
and for
she's
that
probably
reason
doesn't
that
want to go
she's
to
probably
school.
doesn't
Now,
want to
the
go to
question
school. Now,
is:
the question
is this a real
is this a
concern?
real concern
Um,
um,
or about the
or
mother's disease,
about the
or is it
mother's
like,
disease, or is it
because
like,
mother will not be
because mother
around
will not be
and
around
she'll be
and
having
she'll be
separation
having
anxiety,
separation
things
anxiety,
like that.
things like that.
So,
So
even 12 years, we learned
even
that
12 years,
separation
we learned that
anxiety is
separation
common in
anxiety
more
is common in more
early age group
early
younger,
age
but
group younger, but
honestly,
honestly,
by definition,
by
honestly,
definition,
by
honestly,
definition,
by
separation
definition,
anxiety
separation
can be up to
anxiety
the age
can
of
be
the
up to the
even
age of
18.
the even 18.
Okay. That's the
Okay,
thing. So
that's the
our
thing.
final
So
answer for
our
the
final answer for
question
the
number 10,
question number 10,
final answers to
final
separation
answers to
anxiety.
separation
I'd like to
anxiety.
add something
I'd like to
here
add something here
to our dear doctors.
to
Now,
all
see,
dear
even we
doctors.
are
Now, see,
grown up.
even we are grown up.
Of course, we grown up. You
Of
guys
course,
are
me
grown
grown
up.
up.
That's
You
why
guys
you
are
were in
grown
the
up. That's why
class.
you were in the class.
Um,
Um,
maybe a little bit more
maybe a
applicable
little bit
for
more
the
applicable for the
um,
um,
female doctors
female
attending classes
doctors
here.
attending classes here.
Um, how is that feel?
How is
Like,
that
those
feel?
of you
Like,
are,
if
I
those of
think,
you are,
married and
I
I
think,
think
married and I
shifted,
think shifted,
or maybe
or
some
maybe
of you shifted to
some of you
Australia.
shifted to Australia.
Like,
Like,
I always feel
I always feel
living
that,
parents, there's always
living
some
parents,
sort of
there's always
separation
some sort of
anxiety.
separation anxiety.
Does not matter that,
Does not
how much
matter
we
that,
have grown
how
up.
much we are grown up.
I'm not sure,
I'm not sure,
how much you
how
guys
much you
agree
guys agree
on that point,
on that
but
point, but
it happens. I
it
think this is,
happens.
I
I think
think,
this is, I
one of the
think,
part. This is
one
one
of
of
the
the
part.
hard
This is
part
one of the hard
of
part
going to Australia.
of going
Actually,
to Australia. Actually,
everything will be
everything
perfect
will be
for
perfect
you. Good
for
life, good
you, good
money.
life, good money,
Everything. But that
everything. But that
sense of
sense of
separation, anxiety
separation,
feeling is there
anxiety
actually.
feeling is there actually.
Of course,
Of course, like,
guys are a bit
guys are a
tougher
bit
sometimes.
tougher
So
sometimes.
maybe
So maybe
suffered a little less.
suffered a little less.
Yes.
Yes.
But
But
I think,
I think,
okay, good one by one
okay,
of the
good one
doctor.
by one of the doctor.
Spoil the whole
Spoil
emotion, I
the whole
think.
emotion, I
But
think.
that's okay.
But
No,
that's okay.
it
So
comes out little
it
later.
comes
I
out little
mean, it's
later.
not
I mean,
the
it's not
time now,
the
actually.
time now,
Yeah,
actually.
I think
Yeah,
that is,
I think that
I
is,
think it's more,
I think it's more,
sometimes maybe
sometimes
in our
maybe
countries,
in our
sometimes, we are
countries,
a little
sometimes,
bit more
we are a little bit more
emotional with the
emotional
parents
with
sometimes,
the
actually.
parents sometimes,
Yes.
actually. Yes.
Great.
Great.
Yeah, someone's, I
Yeah,
like that
someone's,
statement,
I like that
honesty over
statement.
the
Honesty
anxiety. I mean,
over
the
the anxiety.
situation
I mean, the
here and this,
situation
that,
here and this, that,
that plays more part
that
over
plays
the
more
anxiety.
part over the
Very good.
anxiety. I think. Very good. Very
Okay. I mean,
okay.
our situation,
I mean,
I
our
think,
situation, I think,
situation was not like
situation
that.
was not
Even
like
if we
that.
go like a
Even if we
15
go
years
like a
back,
15 years back,
honestly speaking,
honestly
even in your
speaking,
country,
even your country,
human used to be at least
human
bit
used to be
human,
at least bit
right?
human, right?
Now, I think
Now, I
it's one of
think
the reason people
it's one
want
of
to
the
shift
reason
is
people
not
want to
only
shift
it's
is not
always the
only
money, of course,
solace the
money,
money, of
good
course, money,
life, those
good life,
things,
those
but
things,
I think the
but
proper
I think the
respect,
proper respect,
security. There's a very
security.
big
There's a
portion
very
of doctor.
big
They also
portion of
want to
doctor. They
migrate
also want
because
to migrate
they don't
because
feel their
they don't feel
kids are
their
safe
kids are
much
safe
here, or they
much
want
here,
their
or
kid a
they want
better
their kid a
education, which
better education,
they
which
think
they
uh,
think
the
uh,
kids deserve
the
actually.
kids deserve
Yeah.
actually.
All
Yeah.
right.
All right.
This was one of the
This was one of the chart, I think. Last day is one of the chart. Identify this growth chart. And yes. Okay, by the way, guys, if you go to our video channel, this growth chart related one file is already there. Okay, so some of you, I think, mentioned in the inquiry zone, like what the growth chart is not available. Growth chart related separate file is available in the file section. Yeah. Now, coming to this one, so you just need to go to the video channel library group, go to the file section and find the growth chart file. Okay. This one, what do you think? I mean, we have discussed last time. So there was few things we learned, like uh, this one is a chronological age. This is your current age, which is the bony age. Right? Like imagine, like, what is supposed to be and what you are now actually. Often we have seen in by early age in the school, like class 8, class 9. At some point we were short and suddenly we all boys are becoming quite taller with time. Right. So that's one of the things. Now in this case, what do you think? It was in the same rail track. Okay. And then it was little down. So bony age is less than chronology. Can you say like that? Bony age is less than chronology. So it means there is hope. Right. Because bone is less than chronology. Like what is supposed to be it is less means there is a hope for the growth. So this one will go with a bone age less than this is constitution. So this one was a constitutional delay. Constitutional delay. It's more physiological. But the same situation can be abnormal or endocrine. Okay, so another one which was also present on the last day. What is your diagnosis here? Do you think this one is also bony age is less than chronological age? I'm going a little faster because this was last day it's been discussed. So it started, suddenly it's going down and then it's going up. After replacing with a hormone, then it goes up. So it's a pathological. Can you say it's a pathological? You need to give something from the side. Okay, so this one again, bony less than the chronology. Again, this one bony less than the chronology, and you have to give external support, then it goes up. So this one answer is a endocrine or abnormal or pathology, growth hormone deficiency. Growth hormone deficiency. Last but not the least, what is your common diagnosis in this particular case? Throughout, somehow it managed to stay the same track. Managed to stay in the same track. So can you say in this case bony age? This is a bony age. Is a chronic age. Bony equals to chronological age. Now again the chart bony equals to chronological age. This is short stature. Familial short stature. Again this one familial short stature. Yeah, or genetic short stature. I hope that's clear to everyone. Last year we discussed it even more actually. Next, mother takes a 9-month child with irritable bowel with a bile stain vomiting. Now again a case related to child with a vomit. Last year we discussed few about the child with vomit. So vomiting and diarrhea to see the local GP, very common for the GPs to get these cases. She says the baby was doing fine until today the baby kept vomiting. Food. Like ultrasound shows. Not a shadow in the light upper quadrant. What you do next? Want to do next? So bile stain vomiting and diarrhea. Not really mentioned about fever though. Bile stain vomiting. Now, when you say this word,
uh,
uh,
bile stain vomiting.
bile stain vomiting.
What does it indicate?
What does
Is
it
it a
indicate?
upper
Is it a
GIT
upper GIT
related or a bit
related
lower
or a bit
GIT
lower
related?
GIT related?
It comes from
It comes from
bit lower, a
bit
bit
lower,
lower
a
actually.
bit lower actually.
Anyways, can you
Anyways,
say it's a
can you
possibility
say
of
it's a
obstruction because
possibility
it's
of
a
obstruction
kid's
because it's a
case
kid's case
and bile stain
and
vomiting.
bile
Bile
stain
stain vomiting
vomiting.
often
Bile
is a
stain vomiting
sign,
often is a
is a
sign,
possibility of
is a
obstruction.
possibility of
So
obstruction.
it's not
So
urine,
it's
it's
not
not
urine,
probably the
it's not
stool.
probably the stool.
So I think
So I
it's
think
better time
it's
if we
better
suspect
time if we
obstruction
suspect
to
obstruction.
think more
We
about
think more
I
about
think air
I
enema
think
and
air
this thing.
enema and
It's a
this thing.
possibility.
It's a possibility
To rule out first
to
actually.
rule out fast actually.
Yeah. If
Yeah.
they
If they
uh,
uh,
give us the option
give us the
X-ray, that
option
could have been the
X-ray, that
answer,
could have
like
been the answer, like
a possible
a
obstruction
possible
case, and
obstruction
we are doing
case,
an
and
X-ray,
we are
could
doing an
be
X-ray, could be
a better
a better
diagnostic thing.
diagnostic
But
thing.
since X-ray is not there, we
Since
have to
X-ray
look
is not there,
forward.
we
What
have to
is the
look forward.
relevant?
What is the relevant?
If you
If
mention,
you
if you
mention,
remember, I have
if you remember,
mentioned
I have mentioned
some questions can
some
be
questions can be
asking you
in between an
in between an
investigation and
investigation
an
and
approach
an
actually.
actually. Okay. Would you have an ultrasound
Would you
file
have an
in the right
ultrasound
upper
file in the
quadrant
right upper
having
quadrant
some shadow?
having
They
some
also
shadow?
mention.
They also mention.
No.
No. So somebody
It's
here
just 9 months
is just 9 months
bile stain vomiting.
and the
It's a
bile stain vomiting.
possibility
It's a possibility
some sort of
of
obstruction.
some
Could
sort of
be
obstruction. Could be
intersusception, but
intersusception,
still need
but
more
still need more
testing things to rule it
testing
out
things
actually.
to rule it out
But
actually. But
we have to initiate the
we have to
enema and
initiate the
restart
enema and
as
restart
soon as possible.
as soon as possible.
Okay.
Okay.
So intersusception
So
cases
intersusception
rate.
cases rate.
Someone saying
Okay,
duodenal
someone
atresia. Good
saying duodenal
question.
atresia. Good question.
Duodenal atresia has an
Duodenal atresia
interesting
has an
thing.
interesting theme.
Special point. Sometimes
Special
they give
point. Sometimes
X-ray.
they
Very
give
popular in
X-ray.
NMC
Very
part
popular in
2.
MC Part 2.
They give a double
They give
bubble
a
sign.
double bubble sign.
Okay, they'll give you an
Okay,
X-ray.
they'll give you an X-ray.
Often they'll be
Often
mentioning
they'll be
higher
mentioning
chances, double
higher
bubble
chances,
sign.
double bubble sign.
Especially
Especially duodenal.
that particular case. It's a
That
good question
particular
actually.
is a
It's a
good
very
question
smart
actually. It's a
question.
very smart
We
question.
always like smart
We always
questions
like
actually.
smart questions actually.
Okay. Sometimes you might
Okay.
feel in the
Sometimes you
classes I
might
do,
feel in
I
the
don't
classes
take
I do.
much
I
because
don't
not
take
all
much
questions
because
are
not
like
all questions
that
are
smart
like
actually.
that
It's a
smart
very
actually.
smart
It's a very
diagnostic
smart
question.
diagnostic
That,
question.
how about
That how about
duodenal
duodenal
atresia? Yes.
atresia?
Okay.
Yes.
Possible?
Okay.
An
Possible
obstruction, but
an obstruction, but
double bubble sign
double
actually.
bubble
Now,
sign
can it be
actually. Now,
pyloric
can it be
stenosis
pyloric
like child
stenosis like
vomiting?
child vomiting?
Is that?
Is that?
Answer is a no. First
Answer
of
is a
all, in
no.
pyloric
First of all, in
stenosis, we
pyloric
don't
stenosis, we don't
appreciate any bile
appreciate
stain
any
from.
bile stain from.
Okay, so that's
So
another
that's
point.
another point.
Can it be
Can it be
gastroenteritis? Because
gastroenteritis?
gastroenteritis
Because
also has vomiting
gastroenteritis
diet.
also has vomiting
So
diet.
can it be
So can it
gastroenteritis
be
as well?
gastroenteritis as well?
Why not
Why
gastroenteritis?
not
Because
gastroenteritis?
I don't
Because
see
I don't see
anything mentioned about
anything mentioned
high
about
fever.
high fever.
Great.
Great. Some
if you're
cases,
lucky,
if
they
you're
might
lucky,
also give you a
they might
picture
also
like
give you a
this.
picture like
This is
this.
called a very
This is
classic
called a
clause
very
sign
classic
in a
clause sign in
intersusception
a
cases.
intersusception
Sometimes
cases.
they might also mention
Sometimes they
by any
might
chance
also
they
mention by
mention
any chance
like
they
that's like a
mention like
jackpot for
that's like a
you.
jackpot for
That
you.
is like
That is
red
like
currant jelly
red current
stew,
jelly
right?
stew, right?
Anyhow, they mention that
Anyhow,
one.
they
It's
mention
like
that
a.
one. It's like a.
So here's few lines.
So here's few
Obstruction
lines.
features.
Obstruction
Red
features.
currant jelly
Red currant
stool
jelly
or red
stool
currant jelly.
or
Put
red
on these
current
things
jelly.
if they
But on these
mention, it's
things,
a
if they
very more
mention,
higher
it's a very
chances
more higher
can
chances
be into
can
susception.
be into susception.
Okay, this is something that's
Okay, this is
stress.
something that's
One of the
stress.
topic.
One of the
What's the
topic.
most
What is
initial
the most
investigation for a
initial
child presenting
investigation
with
for a
a
child
rheumatic
presenting with
fever?
a rheumatic fever? So this is the initial test for a rheumatic fever. We do have this one in the rheumatology now, so overlapping topic. It's also a pediatric topic at the same time. So they're asking initial. So initial thing for this thing, if you remember, Jones criteria major minor. So Jones criteria, in the minor, did you find this thing, this ESR, if you remember? Did you find this ESR thing in the Jones criteria? We do? Yes. So they ask about the what is the initial investigation. So initially, can we do this CBC thing or ESR thing? Yes, we can certainly do that. For more confirmation, we can go for the throat swab. Okay, so for one more confirmation, we can go for the throat swab. So that's the Jones criteria for rheumatic. I think it's something we all learned in the MBBS, rheumatic fever, Jones criteria, major criteria, minor criteria. Which case, I mean, definitely we give antibiotics, but the question is up to how long we are using the antibiotics. If carditis is present, maybe up to age of the 21, we have to use antibiotics. Okay, so initially, I mean, so you're going for an initial investigation as yes, sir. Most appropriate or confirmatory is a throat swab. This particular chart is taken from the RCH guideline. You can take a screenshot of this one, but I recommend you for rheumatic fever, maybe one time you can get into or type like this rheumatic fever RCH guideline. Because you started pediatrics, now your main search engine should not be RSCGP rather than the RCH guidelines. Okay. I mean, of course, we are following the John Mukhtar class, SMA notes. Okay, we'll be following them. We have another major class coming up on this coming Sunday because that's more on the John Mukhtar. But individual topic things, it's more about the RCH guidelines. So individual topic, if you want to do more research, RCH is more authentic for Australia. Alright. Moving forward. Okay. After this question, probably we'll go for a break. Yeah. The flowchart also has the option. Thank you, sir. Okay. A 7 days old boy got to the pediatrician with a knee and knee pain. This is probably an overlooked topic of pediatrics and also orthopedics. Lengthing is a moreover an orthopedic topic, but it comes in the pediatrics. You prefer to tell a bit more about it in the pediatrics. Okay, next day will come in more details, but it's any denies any recent infection or status symptoms, vitals are normal, knee seems normal. However, note that some atrophy of the upper thigh, reduced abduction, and some asymmetry. This is spatial radiograph showing increased density of the femoral head. This is absolute important. Okay, many going for sleep capital femoral epiphysis. Okay. My answer is Parthes disease. Let me explain this one. This is a nice chart, John Mukhtar chart. No worry, it will be coming tomorrow, so don't need to worry about it. But let me just explain this one. It will be easy for all of us actually. Okay. If we're going to break, so this is a nice thing to end before break. No. The title is Limping Lips. Limp. With limp related, there's a very famous TV series. House Ending, Dr. House, anything you remember. Anyways. His situation was different. But this is a limp related to kids. Age groups are different. 0 to 4. 0 to 4. 4 to 8. 4 to 8. This is 10 plus, as you can see. as you can see.
At any age group,
At any age
septic
group,
arthritis can
septic
happen.
arthritis can happen. Let me tell about septic arthritis
At
first.
any age group,
At any age
if
group,
there is a
if there is a
joint,
joint,
you know, somewhere like a
somewhere like a
joint pain,
plus
redness,
redness, plus swelling, but it is unilateral. With all these things, if there is any high fever is present,
so
right? So unilateral joint pain, swelling, fever. Again, unilateral joint pain, swelling, fever, suspected septic arthritis, unproven otherwise. From this sections we can make multiple questions. Very popular in the exam. I mean, one diagnostic septic arthritis we have seen in rheumatology. Okay, in a normal person, septic arthritis chances are more, or defective joint. This is not about pediatrics. Let's talk a little bit about the adult cases.
In a defective
In
joint
a
like
defective
rheumatoid
joint like
arthritis,
rheumatoid arthritis,
osteoarthritis,
osteoarthritis,
higher chances of
higher
osteoarthritis
chances of
last day.
osteoarthritis
We have
last
seen
day.
that one.
We have seen that one.
Another question in a
Another
septic
question in a
arthritis,
septic
what is
arthritis,
the
what is
primary
the
management?
primary management?
Joint fluid aspiration
Joint
or
fluid aspiration or
arthrocentesis
arthrocentesis,
or giving an
or
antibiotic
giving an
first?
antibiotic first?
Answer. Joint
Answer.
aspiration
Joint
first. So
aspiration
please remember
first.
this
So
one.
please remember this
In a
one.
spatial line,
In a spatial line,
aspiration,
aspiration,
aspiration
aspiration
first.
first.
This is very important
This is
for
very important
for
MCQ
this
for
particular section.
this particular section.
Okay, septic arthritis
Okay,
done.
septic arthritis done. I think everyone is
Among the
clear.
antibiotic, we
Among
give
the antibiotic, we
flucloxacin.
give flucloxacin.
Initially injection and
Initially
later we
injection
convert
and
into
later we
oral. Now
convert
coming
into
back to
oral.
this
Now
one,
coming back to this one,
have you ever heard
have
this
you
kind of
ever
thing
heard this kind
at
of
the
thing
time
at the time
of kids
of kids
discharging
discharging a
the
newborn?
physician
The
is coming and
physician
telling the
is coming and
parents
telling the
that there is some
parents
abnormal
that there is some
sound when
abnormal
I try
sound
to
when I try to
abduct the
abduct
both thighs.
the both
There's some
thighs.
clunks
There's
type of
some
sound
clunks
and we
type of
want to
sound, and we want
keep the
to
baby for some
keep the
time
baby for some time
to make it more correct.
to make it more
And
correct.
yes,
And
so
yes,
this is a spatial
so this is a
test
spatial test
available called
available called
Autolanis and Barlow's
Autolanis
test.
and
Autolanis
Barlow's
and
test.
Barlow's actually.
Autolanis and Barlow's actually.
So this is nothing
So
but a
this is nothing but a
DDH,
DDH,
developmental dysplasia of the
developmental
hip.
dysplasia of the
You know,
hip.
if you try to
If you try
abduction
to
of the both,
abduction of the both,
thighs, there'll be some
thighs,
sort of
there will be some
abnormal sound
sort of
because of
abnormal
some
sound because of some
restriction and this that.
restriction and this
There's a
that.
possibility
There's
of
a possibility of
limp in future in
limp
this
in
case. So
future in
limited
this
movement
case.
in
So limited
abduction.
movement in
Or
abduction.
there is the
Or
ependicitis
there is an
special sound.
ependicitis special
Okay.
sound. Okay.
Some clunk
Some
sound.
clunk sound.
Sound and there are some tests.
And there are some
positive.
tests.
Autolanis and
Autolanis
Barlow's test
and Barlow's
positive.
test positive.
Usually you don't find
Usually
or
you don't
expect any
find or
sort of,
expect any sort of,
you know,
you know, uh,
yeah.
yeah.
Are you expecting
Are
any
you,
sort
are
of
you
fever
expecting
or
any sort of
anything?
fever or anything?
So fever things would be
fever things would be
negative fever.
negative fever.
It's like the septic
It's
arthritis
like the
fever
septic
things.
arthritis fever things.
Because
No.
some of the other
Because
diseases fever
some of the
can be
other
there. That's
diseases
why the
fever
fever
can be there.
point is
That's why the
important.
fever point is important.
Now, similar
Now,
age groups for
age groups for
this two
2842 is this two
conditions.
conditions.
And
Parthes
transient
and
synovitis. One of
transient
them
synovitis. One of
is
them
is usually
after
respiratory
a
tract infection or
respiratory
after a
tract
sore throat.
infection or
And
after
this
a
one is
sore throat. And this one is
By name you can
synovitis.
understand.
By name you can understand.
So after a sore throat,
So after a sore throat,
an
after
infection,
an infection,
there's more higher
there's
chances
more higher chances is a
transient synovitis.
transient synovitis.
More higher chances.
More higher chances. And both of them age groups are
Even
4 to 8.
Parthes for to
Even Parthes for 2 8.
Parthes
But
has a
Parthes has a
P4
P4 positive X-ray.
P4 positive
P4
X-ray. I
positive
highlighted this
X-ray. I
line to
highlighted
remember.
this line to remember.
Written in a different.
Written in a different way.
So Parthes
So
disease
Parthes
P4
disease P4
positive for
positive for the X-ray and all this thing.
So there's a
So
special line.
there's a special line you can see the
this line.
this line.
Dense set.
Dense set. So this dense set line is important.
So increased density of
the femur. I have written this thing in a little different way. Nothing else.
I hope that's clear.
I hope that's
Last
clear.
but not the least, in a
Last but
little
not the
obey
least, in a
skill.
little obey skill.
Okay, sleep capital
Okay, sleep
femoral
capital femoral
amplifies can
amplifices
happen. Next, I'll
can
show you a
happen. Next,
picture.
I'll show you a
Ice
picture.
cream is coming out
Ice
of
cream
its
is coming
cone.
out of its
A
cone.
special type of
A
feature.
special type of
Ice cream
feature.
coming out of
Ice
its
cream
cone.
coming out of its
Sleep
cone.
capital femoral
Sleep capital femoral
amplifies actually. So this
amplifies
case
actually.
also
So
may
this
have
case also may have
X finding actually.
X finding
So two
actually.
condition there is
So two
expecting
condition there is
fever. One is a
expecting fever.
septic
One is a
arthritis, known
septic
as a
arthritis, known as a
transient
transient
synovitis. And
synovitis.
there are two
And
condition
there
where
are
we are
two condition where
expecting
we are expecting
X-ray findings,
X-ray findings,
Barth's disease,
Barth's
sleep
disease,
capital
sleep
femoral
capital femoral
epiphysis.
epiphysis.
Okay,
Okay,
please keep that in mind.
please keep that
Both
in mind.
cases,
Both
kids
cases,
presented
kids
with if
presented
they can
with
walk.
if they can
By the
walk.
way, when a
By the way,
walkable
when a
age,
walkable
in
age,
that cases,
in that cases,
limping,
limping,
some cases pain while
some cases
limp,
pain while limp,
also restricted
also
movement.
restricted
Some
movement.
cases you do
Some cases
examination,
you do
you get to
examination,
see
you
abnormal
get
sound
to
like
see
a
abnormal sound
DDH
like a
cases.
DDH
Clear
cases.
everyone so far?
Clear everyone
Don't
so far?
worry, it will
Don't
again, I
worry,
will
it
bring
will
this
again,
thing
I will bring this
next
thing
day again actually. For
next day
now, this
again
is
actually.
okay.
For now,
So
this is
our
okay.
answer was
So our answer
Barth's
was
disease,
Partz's
P4,
disease,
positive extra
P4,
finding.
positive extra finding.
Alright everyone,
Alright
so now
everyone,
it's
so
time.
now it's time.
Let's go for a break
Let's go for a
with a
break
little happy ending,
with a little
ending with
happy
a
ending, ending
podcast.
with a
We'll come back
podcast.
and we'll
We
go
come back
more
and we'll
interesting
go
questions
more
coming up
interesting
from
questions coming up from
Celiac 65 who
Celiac
says,
65
don't
who says,
worry.
don't worry.
Pediatric you will like a
Pediatric
little
will like
less
a
complicated
little less
chapter, I think.
complicated chapter, I think. Alright.
Okay. We'll see you guys in
We'll
10
see you
minutes. Thank
guys in 10
you. So
minutes.
10
Thank
minutes break
you.
for
So 10
us.
minutes break for us. Hello everyone, let's get started with our next question. Great. All right, everyone. So here we go with our next question. If you want to check the last question, which was the recap, was a limping kid, and there was four situations, as you can see. Including septic arthritis can be like universal, can in age group, with a very early DDH, 4 to age group 2 conditions. Only one of them has sore throat history with a upper respiratory tract infection. With a slip capital femoral has also positive X-ray finding, as like the birth is. But this case is slip capital cases. They're a bit obese. Imagine in that way, like a obese people, they sleep a lot. So slip capital, like a, mostly the bony part that sleeps actually. Ice cream is out of its cone. I will show you an X-ray some other day. Let's move forward to the next one, and here we go with our next question. We go a little rapid here. 11-month-old child brought by mother, and who started solid 6 months ago. He's having now frequent loose motion, lost weight. The percentile is down. It is the most 25% from the 50. Now, what is this kind of situation is called normally? These particular situations are called failure to thrive. Failure to thrive. We have to be careful about this kind of failure to thrive things are often given in our exams actually. Right. Now, what was the right answer here? So failure to thrive and all these things are happening. This is very classic for the cystic fibrosis. Very classic for the cystic fibrosis. Now let's see and criticize this question. Main point was if bowel is affected in cystic fibrosis, yes. Weight loss can happen, yes. Failure to thrive can happen, yes. But there are some more features that can happen with cystic fibrosis. Because of a primary defect in the chloride channel. Now, when you have a primary defect in the chloride channel, what really happens here? There's a chloride and there's sodium. Now, sodium that enters inside the cell and in exchange of the like chloride, which usually goes outside, that's how the chloride channel. Now, if there is a chloride channel blockage, the sodium which is supposed to go inside the cell from the extracellular now can't go. So sodium stays. Now, have you ever heard about this term? Cystic fibrosis are also called salty babies. Okay, or even salty human, whatever you say. It's because the sodium level in the serum it's higher actually. Serum is a part of extracellular fluid, so it's higher because of the it's defective in the chloride channel. Another interesting thing, observation of mine, that in cystic fibrosis, of course, there is failure to thrive. Now, if we highlight what is important for EMC is let's write this word thrive. Failure. Then very popular are these lung things, respiratory tract infection, which will be repeated. There will be lots of GI, symptoms in a form of malabsorption, in a form of other means steatorrhea. This can happen actually because your pancreatic secretions can also get affected. And also other part of the system can be affected at the same time in cases of cystic fibrosis. So can you say this is a multi-system involvement? Yes. Can we say since sodium level is high in the sweat, so we can do a sweat test? Yes. Can we say in a cystic fibrosis because of you have issues with anything which is not fully like secretions become thick. I like to use a concept. Any type of secretions become quite thick here. Now, is that a good news? What do you think? If your plural secretions become thicker, if your plural secretions become thicker, more thickening in the throat or main thickening in the nasopharyngeal area, it's not good. So that means you have more chances of infection. Thus gives rise to repeated respiratory tract infection. Clear? Now, more thickening in the biliary area, more thickening in the bile can give rise to gallbladder, and this gallbladder thing is a feature. Honestly, this gallbladder thing is also is a feature. Then pancreatic exocrine secretion can get affected. So can you say pancreatic exocrine secretion get affected thicker? It means it cannot digest the fat properly. So that's why malabsorption and stoturia at the same time. Intestinal secretion affected. That's why rectal prolapse. That's why rectal prolapse. Seminal fluid secretion also affected. So lastly can we add there would be infertility as well. So answer is yes for all of them. It's an interesting observation, right? So I remember that headline, all secretions affected. I remember the word the chloride channel is defective. That's why sodium cannot enter. So sodium remains salty, and this thick secretions at the same time. Okay, is the fate is good. If you remember, I always mention it to you guys. We need to remember about the prognosis of the fate. The fates are usually not good. Those are diseased cystic fibrosis. I'm not talking about the carrier. Those are the diseased of cystic fibrosis. Very high chance they can develop very dangerous pseudomonas and they can die. So, if you ever heard about the prophylactic antibiotic for dental, for genitourinary, or for rheumatic fever, this is another condition by prophylactic antibiotics. I remember I watched a video on YouTube. A kid, like a young female kid, like not young, like a small female kid, like a 8 year or 9 year, she's very angry. Why? Because she was brought every day in a different place to give some antibiotic actually, and she does not like it actually. So everyday antibiotic, and so nowadays the good news is the antibiotics are given. Is it it's possible? Have you ever heard that antibiotics can be also given in a inhalation route? Of course, route is a route, any route you can give. But did you know this thing that antibiotics can be also given in a inhalator? There's a drug called tobramycin. Okay, you can search with it. Tobramycin and in cystic fibrosis because a small kid you can't expect a small kid to get injection every day. So the tobramycin in an inhalation form it's given to the cystic fibrosis kids. Okay, great. All right. You can see that one. And N-acetylcysteine to loosen the mucus plug. We don't want any mucus plug in the lung area. Most of the cases, cystic fibrosis died because of the respiratory tract infections, pneumonias actually. Next question. Next question. 6 months infant. 6 months infant. Very easy peasy question. It's if anyone has kids, they know it very well. 6 months brought by the mother who's a pass stool for last 2 life. So kids and not passing a stool. I think it's a quite universal thing, right? The kids who are not really passing a stool is quite a universal thing actually. So things are normal with this kid and the mother is constant. So what is your management in this particular case? Should he reassure it's in normal variation or should he give something extra? Because see already 4 days, that's the main complaint. So winning is not something to brought at this point now. So I think it's a more better answer would be. There was doubt between these two answers. One is a stool softener using and reassure. Now we find something in the RCH guideline like up to how many days not passing is still considered normal. Up to how many days not passing is still considered normal? I think it varies. I found up to 5 days in some Australian guidelines. Okay. So here is the thing. It's not an uncommon scenario. Those are kids. Yeah. All right.
So you can
Alright.
check in some
So
of
you
the
can check in
guidelines,
some
like
of the
how many
guidelines, like
days
how
it's
many
considered
days
normal.
it's considered normal.
It may not be very
It
up
may
to
not be
country. I
very
think
up to country. I think
there should be a
there
clear
should be a
guideline.
clear
I think
guideline. I
5 days
think
we can take
5 days
it
we
actually.
can take it actually.
Okay.
Okay.
Now, if you want
Now,
more
if you
advanced
want
thing,
more
even
advanced
5 days
thing,
crossed
even
and
5 days crossed and
things are not happening,
things are not
uh,
happening,
you might start
you
thinking
might
if it is
start
abnormal
thinking if it is
situation or not.
abnormal situation
So
or
look
not.
into like
So
abdominal
look into
pain
like
or any
abdominal
abdominal
pain or any
distension. Look
abdominal
for any
distension. Look for any
obstructions and things like that.
obstructions and things like
So,
that.
but
So,
there's also options
but there's
available
also
like
options
stool
available like
softeners.
stool
Actually,
softeners.
those
Actually,
kids
those
randomly doing
kids
it.
randomly doing it.
And randomly it is
And
happening. There is a
randomly it is
things
happening. There
available.
is
Is
a
stool
things
softener.
available. Is stool softener.
In Australia, it's a
In
very
Australia, it's a very
commonly available.
commonly available.
This stool softener, and
This
many of
still
the
software,
mothers
and many
they
of
are
the
using
mothers
it. They don't
they
have.
are using it. They don't have.
I saw
Um,
my
I saw
sister kid. He
my
was also
sister kid. He
struggling,
was
and
also
I
struggling,
saw
and I saw
my sister all
my
the time.
sister
She
all
was
the
giving,
time. She was
the
giving,
prune.
the
You
prune.
familiar with the
You
prune thing?
familiar with the prune thing?
Not sure.
I'm not sure.
Available in this
Available in
Asian
this Asian
region. I
region.
think the
I
prune
think the
juice, prune juice. I mean, juice is
prune
not
juice. I mean,
really
juice is
artificial
not
things, not
really
recommended
artificial
for
things, not
kids,
recommended for
but
kids.
the
But
prune is like a
the
plum
prune is like
actually.
a plum
So
actually.
the prune
So
and
the prune
those
and
prune are also
those
available
prune
in
are
some
also
of the
available in some of the
packets for the
packets
kids
for
actually.
the kids
So
actually.
they
So
like it. So
they
they
like it.
give those
So
small
they give
sachet
those small
to
sachet
the kids.
to
Actually, it's
the
already
kids
messed
actually.
up
It's
in things.
already messed
Actually,
up in
sachets are
things actually.
available,
Sachets are available.
and
And my
sister's kid was like
sister's kid was like
eating that particular
eating that
things.
particular
But then
things.
the regular
But
one to
then
think
the
he
regular
was
one
only
to
up
think
to
he was
eating that
only up to eating that
particular sachet of prune.
particular sachet of prune.
Yes. Yeah,
Yes.
prune juice
Yeah,
will also work for
prune juice will
adults, but
also work for adults.
in
But
our country,
in
prune
our
is
country,
less
prune
available.
is
The
less available.
classic
The
prune, the black
classic prune, the black
prune is less available,
prune
but
is less
actually it's
available. But
very
actually,
tasty.
it's very tasty.
It's a dried plum,
It's a
yes.
dried
Excellent.
plum. Yes. Excellent.
Okay.
Okay.
A two
Okay.
year having
A 2 year
pertussis.
having
By the way,
pertussis.
pertussis
By
is
the
a
way, pertussis is
notifiable
a
disease.
notifiable disease.
Pertussis is a
Pertussis is a
notifiable disease.
notifiable disease.
Now,
Now,
in this case,
in this case, what do you think?
what is the right answer?
What is the right answer?
So, in this particular
So, in
cases,
this
what do you
particular
think? What is the
cases, what do you
really
think? What is the
right
really
answer?
right answer?
A quick thing.
A quick thing. I will tell you about the
pertussis.
pertussis.
So, in
So,
cases of
in
pertussis,
cases
is
of
it important
pertussis,
to give
is it important to give
prophylaxis?
prophylaxis?
The term is
The term is
the classic thing is
the
here.
classic thing is here.
And, should we give
Should we give
prophylaxis
for
pertussis
pertussis
like
patient?
exposed to
Like
pertussis, maybe in
exposed
the
to
same
pertussis, maybe in the
household,
same household.
and
And
the others can be also
the
exposed.
others
It's
can be also
like
exposed.
think
It's
about
like
in
think about
Australian
in
context.
Australian
Think
context.
about in Australian
Think about in
context.
Australian
Yes, it
context.
is very much
Yes,
so.
it is very
If
much
you
so.
sing the John
If you
method,
sing the
it
John
is
method,
recommended
it
about
is
the
recommended
pertussis
about
things,
the
like
pertussis
the
things, like
erythromycin,
the
the
erythromycin,
antibiotic.
the antibiotic.
If kids cases
If
based on the
kids
close, by
cases
the way,
based on the
dose
close,
is
by the
not
way, dose is not
required for the AMC
required for
exactly.
the
Here it's
AMC
just
exactly.
mentioned
Here
for
it's
your own
just
sake.
mentioned for your own sake.
All right. Again,
All
for
right.
the pertussis
Again, for
things,
the
your
pertussis
choice
things,
of
your choice of
investigation as similar as
investigation as similar
bronchiolitis
as
is the
bronchiolitis
nasopharyngeal
is the
swab and the
nasopharyngeal swab and the
PCL.
PCL.
Okay.
Okay.
So you can see this is
So
the
you can
thing.
see this is
We are
the
giving
thing.
the
We are giving the
prophylaxis.
prophylaxis.
Okay. So you see,
Okay.
pertussis,
So you see,
whooping cough.
pertussis, whooping cough.
Have you ever seen a whooping
Have you
cough
ever
in your
seen a
life?
whooping cough in your life?
I don't think so. It
I don't
does
think
not
so.
much
It
exist
does not much
nowadays, actually.
exist nowadays, actually.
It's more over like this.
It's more over like this.
So it's more over like this.
So it's more
actually.
over like this, actually.
Okay. There's a
Okay.
there's a cough and there's a
There's a
long
cough and there's a long
okay.
hook.
So
Okay.
that's how
So that's how it's called 100 days cough, but any cough which is quite prolonged more
I
than
think two
I
three
think
weeks, you
two
can
three
also
weeks,
suspect. But
you can also
that's the
suspect. But
pattern.
that's the
And
pattern.
you can also
You
check
can
in
you
the
can
YouTube.
also check in the YouTube.
I couldn't
I
act
couldn't
as good as, of
act
course,
as
like
good
the
as of course like the
pertussis patients, but
pertussis
it's more
patients,
like
like,
the
but it's more like the
like it's kind of like
like
that.
it's kind of like that.
Okay.
Okay.
Yeah, machine gun shot
Yeah,
cough. You
machine gun
can
shot
say more
cough. You
like
can
that.
say more like that.
Cysteine,
Cysteine,
erythromycin, azithromycin. These
erythromycin,
are some of
azithro.
the
These are some of the
prophylactic treatments.
prophylactic treatments.
Next is a
Next
interesting
is a
one.
interesting
2 year
one.
child,
2-year child,
painless lateral neck
painless
mass.
lateral neck mass.
Okay. With a
Okay.
neck
With a
extension,
neck
with a
extension,
tilting head to
with
the
a
one
tilting
particular
head to the
side. What
one
is the
particular side. What
diagnosis?
is the diagnosis?
Now here is the thing.
Now here is the
This thing
thing.
is a
This
possibility
thing is
of
a possibility of
sternocleidomastoid tumor. I
sternocleidomastoid
repeat,
tumor. I
these
repeat,
things can be
these things can be
sternocleidomastoid tumor.
sternocleidomastoid tumor.
Okay.
Okay.
Now, is it
Now,
possible this
is
can
it
be cystic
possible this can be
hygroma?
cystic hygroma?
Is it possible this can be?
Is it possible
It
this can
can
be?
be also in the
It can
lateral
be
side,
also in the
but
lateral side,
in
but
cystic
in
hygroma
cystic
we
hygroma
have
we
some points
have
actually.
some
Cystic
points
hygroma.
actually. Cystic hygroma.
This tilt
This
thing,
tilt
are we
thing,
expecting?
are
Not
we
really. This
expecting?
tilt
Not
thing
really.
we
This
are
tilt thing we
not
are
really
not really
expecting.
expecting.
Rather than in cystic
Rather than in
hygroma, or in
cystic
most
hygroma,
cases,
or
a
in
picture
most
is often
cases, a
given,
picture is often given,
and quite a classic
and quite a
way you can
classic
make a
way you
diagnosis.
can
Like
make
you
a
can see the
diagnosis. Like you can
extensions
see the
quite a wide
extensions quite a
for
wide
a
for
cystic
a
hygroma
cystic
cases.
hygroma cases.
So congenital
So
condition, abnormal
congenital
growth of
condition,
the
abnormal
lymphatic
growth
channel.
of the
So
lymphatic channel.
cyst-like
So
fluid fill,
cyst-like fluid fill,
and some cases there
and
can be
some
even
cases there can be
difficulty
even difficulty
in breath.
in breath.
So nothing really
So
mentioned
nothing
like
really
this.
mentioned like this.
Okay. So picture
Okay.
can
So picture can
uh, help
uh,
you making the right
help you making
diagnosis
the right
for
diagnosis
cystic
for cystic
hygroma.
hygroma.
So here is the thing.
So
Main
here
is
is the
the
thing. Main
ultrasound,
is
and
the
further
ultrasound, and
confirmation
further
is an
confirmation
MRI.
is an MRI.
Here's a little bit more
Here's a
information.
little
I'll
bit
be
more
holding here
information. I'll
for a
be holding
second.
here for a
For
second.
sternocleidomastoid
For
tumor, you
sternocleidomastoid
can take
mastoid
a
tumor, you
snap
can
here.
take a snap here.
You can see often
You can see
counted
often
as a
counted as a
painless lung
painless
with an
lung
another point with
with
the
an another
tilting on the
point with
head
the
to the
tilting on the head to
opposite
the
side. I've highlighted
opposite
those
side. I've
spots actually.
highlighted those spots
It
actually.
can be happening on the
It
either
can be
side of the
happening on
neck.
the
It's
either
not
side
like
of the
a
neck. It's not
bilateral. It's
like
like
a bilateral.
unilateral,
It's like
painless
unilateral, painless
tilting. That's the thing.
tilting.
This
That's the
differentiate
thing.
with the
This
tilting. I
differentiate
mean,
with the two. I
some
mean,
other condition as
some
well.
other condition
This
as well.
tilting of the heads
This
to the one
tilting of the
side
heads to the
help
one side
differentiating with
help
the other.
differentiating with the other.
Painless lung indicating the
Painless lung
tumor,
indicating the
and tilting
tumor,
the head to the other
and
side
tilting the head to the
indicating
other side indicating
it's quite
it's quite
towards the
towards the
sternocleidomastoid tumor.
sternocleidomastoid tumor.
Okay, about the
Okay,
prognosis of this
about the
tumor is
prognosis
often
of this
benign
tumor is
actually,
often
which is a good
benign
news
actually, which
actually,
is a good
and
news actually, and
often good
often a
prognosis.
good prognosis.
Moving to the
Move to
next
the
slide.
next slide.
Okay.
Okay.
Though this thing is a little
Though
bit
this
part of
thing is a little
psychiatry,
bit
but
part of psychiatry, but
that is okay. As I
that
said,
is okay. As
because
I
it's
said,
kids, so
because
it's a
it's
mixed
kids,
up of
so it's a
some like
mixed up of
lot
some
of
like
things, maybe
lot of
one, two
things,
things
maybe
from the
one two
psychiatry,
things
one,
from the psychiatry, one
maybe
two
from the medicine.
maybe from the medicine.
Now this one,
Now this
it's
one,
common actually.
it's
Five
common
years
actually. Five
with a new
years
toy.
with a new
She likes
toy
actually. Every
she
kid
likes
likes
actually.
toy.
Every kid likes
Some
toy.
people say,
Some people say,
my sister was
my
saying that,
sister was
maybe
saying
for
that,
1 hour.
maybe for 1 hour.
Then I saw her.
Then I
I
saw
wish
her.
there is an
I wish there
exchange
is a
program
exchange
for the
program
kids actually.
for the kids
Okay.
actually.
Mother reported
Okay.
she plays
Mother
with the
reported
toy
she
just
plays
few
with the
minutes
toy
and never
just few
touched it
minutes and
again.
never touched it again.
Okay.
Okay.
Then mother also
Then
reported
mother
daughter to
also
be turned the
reported daughter
TV
to
and
return the
leaves it
TV
for a few
and leaves
minutes.
it for a
The
few
mother
minutes.
tries to
The
talk with
mother
the
tries to
daughter, but
talk with the
notice the
daughter, but
daughter is looking
notice the
at
daughter
her
is looking at
for a few
her
seconds like a
for a few
vacant
seconds
look
like a vacant look
and repeats what mother
and repeats
says.
what mother says.
Okay, so
Okay,
repetitive
so repetitive
something we found here.
something we found here.
Every time she's called
Every time she's
by
called
her name, she looks at the
by her
mother for
name,
a
she
few
looks at
seconds
the
and
mother
repeat
for a
the
few
name
seconds and
again.
repeat the name again.
Any idea, any guesses
Any
what it
idea, any
is?
guesses what it is?
This repetitive movement is
This
called
repetitive movement is
stereotype
called
movement.
stereotype movement.
This repetitive movement
This
is called
repetitive movement is called
stereotype movement.
stereotype movement.
and it is going
and
under
it is
the
going under
autism
the
spectrum.
autism spectrum.
It's actually called
It's
rates
actually
actually.
called
So
rates actually.
stereotype is
So
common in
stereotype
autism
is common
actually.
in autism
Under the
actually.
autism
Under
spectrum,
the
there is a
autism
three
spectrum, there
condition
is a
which I will
three
teach you in
condition which I will
psychiatry.
teach you in psychiatry.
One is the classic
One is the
autism.
classic autism.
One is the rates.
One is the rates.
One is the
One is the
Asperger's.
Asperger's.
By the way,
By
Asperger's
the way,
probably you have
Asperger's
seen,
probably you
you
have
know,
seen,
The Good Doctor. I
The
think
Good
there's a
Doctor. I think there's a
medical drama series.
medical
So
drama
the
series.
classic
So
for the
the classic
Asperger's
for
is
the Asperger's
that
is
particular actually,
that particular
right?
actually,
So that's the
right?
classic
So that's
Asperger's
the
actually.
classic
They can be
Asperger's
talented
actually. They
as
can
well.
be talented as
Yeah,
well.
Rich is more
Yeah,
like the
rich is more like the
stereotype movement. This is our
stereotype
tags,
movement. This
and
is
the
our
classic
tags, and the
autism
classic autism
um,
um,
is related to low
is
IQ and
related to
many of
low
the other
IQ and
features
many of the
actually.
other features actually.
Okay. A child 4 years
A
with
child
a
4 years with
second day
a
prodromal,
second day
harsh cough,
prodromal, harsh
fever,
cough,
nasal
fever,
flaring,
nasal
turf,
flaring, turf,
and oxygen
and
saturation is
oxygen saturation is
85%.
85%.
So what do you think, guys?
So what do you think, guys?
So first of all,
So first of all,
the diagnosis is
the
a
diagnosis is a
um, proof.
proof.
Okay, I think everyone is
Okay,
agreed
I
on
think
that
everyone
one.
is agreed on that one.
Diagnosis is a possibility
Diagnosis
of
is a
proof.
possibility of proof.
Okay. It's
Okay,
just a matter of
it's
things
just a
like is
matter of
it a
things like
severe
is it
group or
a
not?
severe group or not?
Okay, coming to that
Okay,
particular
coming
point,
to that
yes, it
particular
is
point,
group.
yes, it is proof,
And
and
it looks like because
it looks
saturation
like
is
because saturation
85%,
is
the
85%.
vitals we
The
have here
vitals we have
is
here
actually
is actually
85%. So
85%.
85%
So 85%
with
saturation
that 85%
with that
saturation. So
85%
certainly
saturation. So
it's
certainly it's
looks quite.
looks quite.
Yeah.
Yeah.
So we are going with
So
that.
we are going with
I
that.
am adrenaline. We have
I am
seen
at
a
We have
previous question
seen
like
a
this
previous
before,
question like this before,
and previous
and
one was a
previous
moderate,
one
so we
was a
input
moderate, so
steroid,
we in for
and
steroid,
this time it
and
was
this time it
adrenaline.
was
Actually, so B is the
adrenaline. So
right
B is
answer.
the right answer.
B is the right answer.
B is the right
This chart
answer. This
probably we
chart
have discussed
probably we
earlier.
have discussed earlier.
Okay.
Okay.
Because you read this
Because you
question
read this question
and come up with an
and
answer
come up
of
with
your
an
own.
answer of your own.
Okay, toddler.
Okay, toddler
With a significant
with a
ostrative sleep
significant ostrative
apnea.
sleep
And check the
apnea, and check
saturations
the
and this that.
saturations and this that.
I'll be back in a minute.
I'll be back in a minute.
Okay, so here is that
Okay,
file.
so here
Maybe
is that
if
file.
anyone is
Maybe
joined
if anyone is
later on
joined
new,
later on new,
this can be
this can
useful.
be useful.
Okay, so non-invasive
Okay, so
ventilation options
non-invasive
like you can see
ventilation options
CPAP,
like you
BPAP,
see
this
CPAP,
particular things
BPAP,
only,
this
this is
particular
oxygen
things only,
saturation
this
related
oxygen
thing.
saturation
We
related
have
thing.
previously
We
discussed
have
this thing in
previously
the
discussed this
respiratory.
thing in the
So it's
respiratory.
like a
So
continuation
it's like a
question.
continuation question. It means to.
Okay.
Okay.
Now here's the question.
Now
10-year
here is the
boy
question.
got by the
10-year
mother
boy got
complaining
by
of
the mother
exercise-induced
complaining of
asthma. Now,
exercise-induced asthma.
asthma
Now,
is a chapter
asthma
which
is the
we finished
chapter
in
which we
respiratory
finished in
in past, but
respiratory in past, but
again,
again,
just to remind you,
just to
if
remind you,
anyone
if
like
anyone
if you guys can
if you guys
revise
can revise
while going
while
through the pediatrics
going
will be
through the
very important.
pediatrics will be
So
very important.
as a
So
continuation, you
as
can
a
see
continuation, you can see
exercise
exercise
induced asthma.
induced
They're asking
asthma.
what is the
They're
most
asking what is
appropriate
the most
for
appropriate
exercise induced
for
asthma.
exercise induced
Last time we
asthma. Like
discussed
last time
exercise
we
induced
discussed
asthma, the
exercise
best
induced
possible
asthma,
would
the
be
best possible would
SABA.
be SABA.
Okay, the salbutamol. So
Okay, the
SABA is the
salbutamol. So
best.
SABA is the
So
best.
here is a
So here is a
reference regarding that
reference
from the
regarding that from the
like
like
RSCGP or
RSCGP
RCH
or
from one of
RCH,
them I have taken
from one
this
of them
one.
I have taken this one.
So exercise induced
So
asthma, as you
excessive
can
induced
see,
asthma, as you can
best
see,
managed with a
best
short
managed with
acting.
a short acting.
Yes, this one.
Yes, this one.
Okay, so
Okay, so
this topic
this
we have
topic
gone through in
we
past.
have gone through in past.
Okay, interesting
Okay,
question. A
interesting
girl is
question.
taken for
A girl is
hospital after
taken
being
for
found
hospital after being found
unconscious.
unconscious.
What is missing part
What
in
is
this question
missing
because
part
of
in
this
this
is a
question
recall?
because of this
Let's
is a
say
recall? Let's
after
say
5 hours, let me
after 5 hours,
clarify.
let
This
me
situation is
clarify. This
happening
situation is
at a
happening
5 year girl,
at a
maybe
5 year
young,
girl, maybe
young
young,
girl, 20
young girl,
years,
20 years,
and
and
she was being
she
unconscious
was
for
being
five
unconscious for
hours. So
five
these two are
hours. So
two of
these
the
two are
important
two of the
mandatory because you
important
need the
mandatory
body weight
because
to
you need
also
the body
calculate
weight to also
what
calculate
sort of drug to
what
give,
sort of drug
and
to
you need
give,
the time
and
frame
you
and the
need the time
duration
frame and the
actually.
duration actually.
Since I mentioned like a
Since I
young
mentioned
and the
like a
sentence
young
five,
and the sentence five,
any idea in cases they
any idea
mentioned
in cases they
paracetamol.
mention paracetamol.
Normally we expect this kind
Normally
of
we expect this
questions to
kind of
be
questions
given
to
like
be given like
multiple doses of
multiple
paracetamol
doses
and
of
this that.
paracetamol and this
That is
that.
how they
That is
give
how
particularly
they
give this
give
question
particularly
multiple
give this
doses of
question multiple
paracetamol.
doses
Now,
of paracetamol. Now,
if
if
somehow that particular question,
somehow
so
that
see
particular
depends
question,
on
so
time,
see
depends
depends on
of
time,
how
depends
many
of
tablets
how many
ingestion.
tablets
So let's
ingestion.
assume
So
this
let's
question
assume this
related to
question
paracetamol
related to
poisoning
paracetamol
or multiple
poisoning or
paracetamol
multiple
things are given. That
paracetamol
is how
things
I
are
have
given.
seen
That is how
multiple
I have
questions
seen
in past.
multiple questions in past.
Now,
Now,
this one you need to follow
this one
less
you
than
need to
1
follow
hour
less than 1 hour
activated charcoal.
activated
Less
charcoal.
than a 1 hour, that
Less
is the
than a 1 hour, that
activated
is the
charcoal.
activated charcoal.
1 hour to
1 hour
8 hour.
to 8 hour.
Now, this is
Now, this
our
is
case probably the
our
five
case,
hour,
probably the five
or if
hours,
supposed to
or if
be our
supposed to
case,
be our case,
then it would be
then it would
measure
be
serum
measure
paracetamol
serum
level.
paracetamol level.
Okay, so interesting.
Okay, so
Measure serum
interesting.
paracetamol
Measure
level
serum paracetamol level
in 4 to 8
in
hours.
4 to 8
It more
hours.
than 8
It
hours
more
than
than
NAC
8 hours
infusion.
than
What is
NAC
NAC
infusion.
infusion?
What is NAC
In
infusion?
acetyl
In
cysteine
acetyl
infusion.
cysteine
So maybe you can
infusion. So
take a
maybe you can
screenshot of this
take a
section
screenshot of
first.
this
Mostly
section
this
first.
section is
Mostly this
needed,
section
but I'm
is needed,
also
but
allowing
I'm
you
also
to
allowing
take a
you
picture of
to
the
take a
full
picture of
one
the
actually.
full one actually.
So in
So
acetyl
in acetyl
cysteine. So
cysteine.
in
So
acetyl
in
cysteine.
acetyl
So but our
cysteine.
answer
So
is
but
here.
our answer
What
is
do you
here.
think? What is the
What do
right
you
answer
think? What
here
is the right
actually?
answer here
It's
actually?
difficult to
It's difficult
find
to
one,
find one,
the exact one
the
because they
exact
didn't
one,
really
because they
mention
didn't
about
really mention about
uh, what to
uh,
do and this
what
that.
to do and this that.
But it depends on the
But it
question
depends on the question
that is coming.
that is coming.
Okay, so maybe
Okay, so
original
maybe
questions are
original
unconscious for a
questions are
long time,
unconscious for a long
maybe more
time,
than 8 hours.
maybe
If
more
maybe
than
more
eight
than
hours.
eight
If maybe
hours,
more than eight
then it is a
hours, then it
possibility.
is a
It can
possibility.
be NAC
It can be
infusion.
NAC
So
infusion.
again,
So
as I
again,
mentioned, it
as I
depends
mentioned,
on
it
time.
depends on time.
So if more
So
than less
if
than
more
one hour
than less than
activated
1 hour
charcoal, one to
activated
eight
charcoal,
hours,
1 to 8 hours,
measure paracetamol level
measure
more than
paracetamol
eight
level
hours,
more than eight
it's a
hours,
NAC infusion.
it's a
So
NAC
it's a learning
infusion. So it's
question.
a
This
learning question.
question
This
is, I
question
would say,
is, I would say,
incomplete. Clear everyone?
incomplete.
There's
Clear
nothing you
everyone?
can
There's
point out
nothing
as
you
answer.
can
So
point
this
out
is
as
a
answer. So this is a
incomplete
incomplete
question.
question.
Mostly we'll take it as a
Mostly we'll take it as a
yeah. Nothing
yeah.
supports B
Nothing
actually.
supports B actually.
Yeah.
Yeah.
Original question will give you
Original
all
question
these
will give
three:
you all these
activated
three:
charcoal,
activated
serum
charcoal,
paracetamol level,
serum paracetamol
NAC
level,
infusion
NAC
together,
infusion
and
together,
patient's age will
and
be given,
patient's age will be
and
given, and
hours highly
hours
expected it
highly
will be given.
expected it will be given.
Okay.
Okay.
If you have any separate
If you have any
question,
separate question,
we will
we
open a
will
inquiry zone. I
open
think we
a
have opened
inquiry
an
zone. I think we
inquiry
have
zone.
opened an inquiry
Feel free
zone.
to ask any
Feel free
separate
to
question
ask
or write
any
it down
separate
now.
question
You
or
can
write it
ask
down now.
me
You can ask
at
me
your convenience,
at your
and I can give
convenience,
you more
and I
reference
can
to
give
you.
you more
That
reference to that particular time. In unit 12 hours after vaginal delivery, notice to be jaundice, so neonatal jaundice, and bacterial showing
microcytic
microcytic hypochromic anemia.
Best investigation. This is
Best
a very
investigation.
brand
This is
new
a
question.
very brand new
This is
question.
a
This is
actually
a actually
just I
just
was modeling a
I was
question,
modeling a question,
and this one just
and this
popped
one
up. I was
just popped up.
supporting
I
the
was supporting
some of
the
the July
some of the
candidates.
July
So it's like
candidates.
a
So it's like a
even yesterday,
even
we
yesterday,
received this one.
we received this one.
Now many of you have
Now,
been
many of you have been
choosing this one as a
choosing this one
G6
as a
PD
G6 PD,
as this one actually.
as this one actually.
Great. Now,
Great.
anyone
Now,
have any
anyone
idea,
have
any
any
cases, what
idea,
can
any
be the
guesses what can
diagnosis?
be the diagnosis?
Macrocytic hyperkalemia, there
Macrocytic
will be many
hyperkalemia, there will be many
diagnoses.
diagnoses.
Okay, good one if you
Okay,
say
good one
hereditary
if you say
spherocytosis.
hereditary
Very good
spherocytosis.
one if
Very
you
good
think
one
like
if you
hereditary
think like hereditary
spherocytosis.
spherocytosis.
If hereditary
If
spherocytosis,
hereditary
if there is
spherocytosis,
any
if there is any
particular test for that.
particular test for that.
ABO incompatibility,
ABO
we cannot comment
incompatibility we
unless we
cannot
have a
comment
Coombs
unless we
positive.
have a Coombs positive.
Okay.
Okay.
AB incompatibility,
AB
we can only
incompatibility
comment
we
if
can
there
only
is any
comment if there is
Coombs
any
positive actually.
Coombs positive actually.
So in this case,
So
we'll
in this
think
case,
this
we'll
more
think
about the
this more about the
hereditary
hereditary
um, spherocytosis. Viral
spherocytosis.
comes often.
Virulence comes often.
So neonatal
So
delivery notice
neonatal
jaundice
delivery
blood
notice
film.
jaundice blood
Now,
film.
delivery information,
Now,
genetic
delivery information,
disorder,
genetic
defects in
disorder,
the
defects in the
spike proteins.
spike proteins.
Spherocytes are more fragile.
Spherocytes
That's
are
why
more
they are
fragile. That's
distracted
why
more
they
in
are
the spring.
distracted more in the spring.
So that's how RBC
So
got more
that's how
distracted.
RBC got more
Spring got
distracted. Spring got
bigger,
bigger,
and child got
and child
jaundice
got
eventually.
jaundice
Anemia and
eventually.
jaundice with
Anemia
them.
and jaundice
The
with
more
them.
accurate
The more
diagnostic test
accurate
for
diagnostic test for
this situation is a
this situation is a
EMA binding test
EMA binding
using
test
flow
using
cytometry.
flow cytometry.
Okay. Is it
Okay.
new for
Is it new for
you guys?
you
Please mention in
guys?
the comment
Please mention
section.
in the comment
This
section.
concept is new.
This concept is new.
This question I have seen
This
with
question I have
hereditary
seen with
spherocytosis
hereditary
as a
spherocytosis as
diagnosis
a
in past
diagnosis
one time as a
in past one
management,
time as a
but
management,
this is a
but
new one I
this is
also
a new
found
one I
actually,
also found
and
actually,
this is tested
and this is
even
tested
just
even
yesterday.
just yesterday.
This is tested
This is tested
just yesterday. So you can see
just
one
yesterday.
thing.
So you can
The
see one
popular
thing.
topic
The
they just
popular
keep
topic they
being
just
bringing
keep being
new
bringing
things, either
new things,
investigation
either
or either a
investigation or
management,
either a management,
those particular things.
those particular
They're asking
things.
about the best
They're asking about the
investigation,
best
my dear.
investigation, my
So
dear.
for ruling out, you
So
can do
for
other
ruling
things,
out, you
but
can do other things,
because
but
we're
because
thinking at the
we're
hereditary
thinking at the
spherocytosis,
heritage
so it's more
spherocytosis,
better
so
we
it's
go
more
with a,
better we go
I
with a,
think, EMA. I
I
think as
think
a
EMA. I think
initial,
as a
we can
initial,
consider the
we can
osmotic
consider
fragility
the
is
osmotic
fine. I
fragility is
also
fine.
think same
I
as
also
you
think
actually.
same as you actually.
Okay, so it is a
Okay,
defect
so
in the
it is a
membrane,
defect in the
leads
membrane,
to
leads
spherocytes
to
and jaundice.
spherocytes and
So,
jaundice.
are we expecting
So, are we
pathological or
expecting
physiological
pathological or
jaundice? So, I think we are
physiological jaundice? So, I
expecting.
think we are expecting.
So, within 12 hours
So,
after
within 12
birth,
hours after
notice
birth,
jaundice. So, it's a
notice jaundice. So,
pathological
it's a
jaundice.
pathological
So, it's a
jaundice.
case related
So,
to
it's a case
pathological
related to
jaundice.
pathological
Because
jaundice.
12 hours after
Because
birth,
12 hours
it's
after
eating
birth,
into. So,
it's eating into.
accurate
So,
test is a EMA
accurate
binding
test is a
test.
EMA binding
Cool?
test. Cool?
Wonderful.
Wonderful.
Okay, another
Okay,
new one
another new
from
one
last one.
from
3 month
last one.
child brought by the
3 month
parent
child brought by
reporting
the
that the
parent
baby
reporting
frequently
that the
turns
baby
blue
frequently turns
while
blue
crying
while
and feeding.
crying and feeding.
Sinuses improve. The child
Sinuses improve. The
placed in a
child
Hilne
placed
position
in a
often.
Hilne
A
position
harsh
often.
systolic
A
murmur
harsh
has been
systolic
observed.
murmur has been
So this
observed.
is nearly like
So
three
this is
months,
nearly like
almost like
3 months, almost like
6 weeks or more than
6 weeks
6
or
weeks
more than
kids.
6 weeks
So
kids.
6 weeks or more
So
than
6
6 week
weeks or more than
kids.
6 week kids.
Cyanosis and the murmur.
Cyanosis and
It
the
is
murmur.
suspected
It is
tetralogy of
suspected
Fallot's until
tetralogy of
proven
Fallot's
otherwise.
until proven otherwise.
Have you guys seen that
Have you guys
website
seen that
before? Med
website before?
Bullets.
Med Bullets.
Medbullus also has a lot of
Medbullus
thing
also
about
has a
tetralogy
lot
of
of thing about
Fallot,
tetralogy of
four
Fallot,
components of
four
tetralogy of
components
Fallot,
of
clinical
tetralogy of
feature of
Fallot,
tetralogy of
clinical
Fallot
feature
and
of tetralogy of
managements.
Fallot and
So you can
managements.
double check that
So you
one.
can double check that
So
one.
yes, so
So
tetralogy of
yes,
Fallot,
so tetralogy of
cyanosis,
Fallot,
murmur,
cyanosis,
6 weeks,
murmur,
good
6 weeks,
shepherd.
good
Double
shepherd.
check the Medbullets
Double
again,
check the
guys.
Medbullets again,
All
guys.
right. I
Alright.
think this
I
thing, I
think
think we
this
have
thing,
done
I
at
think we have
least two
done at
times,
least 2 times,
isn't it? One
isn't
time
it?
I think
One time I
in
think
the
in
medicine
the
and also in the
medicine and
last
also in the
last class again.
last class
So I think
again.
it's important we
So I
can
think it's
skip that
important
one
we
for
can
now.
skip that one for now.
Okay.
Okay.
Straightforward question.
Straightforward
What
question.
microorganism
What
is commonly
microorganism is
associated
commonly associated with
long-lasting dry cough
long-lasting
that may
dry
respond
cough
well to
that may respond
symptomatic
well to
treatment?
symptomatic
Yes,
treatment?
so
Yes, so as we mentioned, microorganism related question does come in the exam. So this is another consequence of that micro, organism related questions. So here we go. Final answer, guys. It's like more about the dry cough. Now, whenever we say the dry cough, it's more towards the which one? So pneumonia. So what type of pneumonia? Atypical type of pneumonia. Remember, atypical type of pneumonia often presents as a dry cough. So it is going more towards the mycoplasma pneumonia. If Legionella would be the answer, there would have been some sort of water source, like air conditioning, blah blah, this that. Great. Great. So it's a multiple. The typical pneumonia, I think this should have been the answer for the classic pneumonia of the typical. This is the atypical pneumonia. I hope that's clear to the dear doctors. You can Google about mycoplasma. You will find so many features actually. But the main thing is a low grade fever and the dry cough. That's one of the main thing. It primarily affects the respiratory tract, especially the upper respiratory tract. So you're expecting dry cough, soreness in the throat, this that. All right. All right. You can double check again in the RCH guideline. And there's the treatments for that particular disease. Of course, it is atypical pneumonia, so treated by this particular specific antibiotics. Okay. Next one. I want pediatrics patient. The age is basic. Maybe let's say 2 years patient exhibiting fever, irritability, cough, dyspnea, crepitation. Chest levels two lesions with the air fluid level. This is a key finding here. Which of the following antibiotic regimen most suitable? So guys, please understand antibiotic related questions will come. So antibiotic names are important. Antibiotic combinations are also important. Some cases little drug interactions will be also important, like warfarin interferes with which particular drug. Let's focus into this one. Check the symptoms, make a diagnosis in your mind, and answer that combination question. This is another pattern of question that you will get to see in MC exam. You have 10 seconds. Okay, that's fantastic. So now, let's just see something motor regimen for this specific diagnosis. Yeah. So option two, ceftriaxone plus metro, commonly used for the border. Yeah. However, the choice influences the factors age, local resistance, many other things. Okay. Okay. It's a high possibility, considering fever, irritability, cough, dyspnea. It's a high possibility this can be an abscess. If there's an abscess, of course, you need a very, high powerful treatment module. For me, technically, C, like number three, number two, both can be correct actually. But metronidazole is getting a lot of resistance nowadays, so hence for the reason actually clindamycin can be an option in that cases. So the ceftriaxone is important as well as this metro IV. These things are also important. Yeah, I think between 2 and 3, I think the question, I think we need a little more information. So, but let's count it as a lung abscess, and I think proceed accordingly will be better. Lung abscess related, I think we have seen in past.
I think we do have the
I think
SMA
we do
node
have the SMA node
in the respiratory,
in the respiratory,
if you remember that.
if you remember that.
So the fever,
So the fever and certain other things. In our question, maybe hemoptysis thing was not there, but dyspnea, cough, fever, those things were there, and with the multiple air fluid levels were there. So being primary treatment is the empirical antibiotics.
So maybe we can do a little
So
bit
maybe
more
we can do a
research
little
on
bit
that
more
one.
research on that
You
one.
can ask me
Someone you
about
can ask me
to
about
give a
to
little bit more
give a little bit more
information about the
information about
lung
the
abscess,
lung
antibiotic
abscess
regimen in our
antibiotic
inquiries.
regimen in
So
our
I'll try to
inquiries. So I'll try
give a
to
more breakdown.
give a more breakdown.
Okay, so I'll try give a
Okay,
little
so
bit
I'll
more
try give a little bit
breakdown
more breakdown
regarding this one. Okay,
regarding
guys.
this one. Okay,
So I'll
guys.
try help
So I'll
you
try help
a little
you
bit more
a little bit
breakdown
more
that one.
breakdown on that one.
Okay, lung abscess,
Okay, lung
X-ray, then
abscess, X-ray,
CT,
then
then
CT, then
bronchoscopy.
bronchoscopy.
Just remind me, guys.
Just remind me, guys. One thing.
Okay, pediatric case
Okay, pediatric case
experiencing
experiencing this particular
swelling
features,
pain in the left
swelling
eye,
pain
and
in
the
the
vision
left
is
eye, and the
affected,
vision is
immediate open
affected,
right eye,
immediate open right eye,
and high
and
fever.
high
Which
fever.
antibiotic would be the
Which
most
antibiotic would
appropriate?
be
So
the
again,
most appropriate? So
antibiotic
again, an antibiotic
relevant question.
relevant question.
Okay, many going
Okay,
for
many going for
option 2, and I think
option
most
2,
of
and
you
I
are
think
correct.
most of you are
Well
correct.
done.
Well done.
Most of you picked up
Most
B.
of you picked up
So I
B.
think now,
So I think
now considering the situation
that
that
child
experiencing
experiencing swelling, pain in the
and
left eye,
vision affected,
and vision affected.
I'll teach this thing
I'll
more in
teach this
the
thing more in the
eye class. There is a we
eye
have two
class. There is a
conditions.
we
One
have
is a
two conditions.
periorbital
One is a
cellulitis, and
periorbital cellulitis,
one
and
is a orbital
one is the
cellulitis.
orbital
Okay,
cellulitis.
so this one
Okay, so
goes
this one
because vision
goes
affected.
because vision
So it's
affected.
orbital
So
cellulitis,
it's orbital cellulitis,
vision
periorbital
not
cellulitis,
affected.
vision
That's
not
the basic
affected.
difference.
That's
So
the basic
this
difference. So this
particular thing is going with
particular
the
thing is going with
orbital
the
cellulitis. If it
orbital
is orbital
cellulitis. If it is
cellulitis,
orbital cellulitis,
IV
IV
flucloxacillin. Clear everyone?
flucloxacillin.
So
Clear
IV
everyone? So
flucloxacillin
IV
high dose
flucloxacillin high
recommended.
dose recommended.
Okay. Next,
Okay.
okay,
Next,
child goes to the school. The
child goes
child
to
can
the
have a
school.
lot
The
of type
child
of
can have a
issues,
lot of type of
including
issues,
you
including
know
you know
infectious disease,
infectious
impetigo.
disease,
So they will tell
impetigo. So
you maybe
they will
yellow
tell you
crust
maybe
lesion
yellow
instead
crust
of
lesion instead of
impetigo. Remember this
impetigo. Remember
yellow
this
crust lesion
yellow
or
crust
a
lesion
school
or a
going kid.
school
Let's say
going kid.
7 years
Let's
kid.
say
They will tell you.
7 years kid.
School
They will
going
tell you.
kid.
So
They
school going kid.
fight.
They
They sit
fight.
together so
They
they
sit
can
together so
get
they can
infected easily.
get
Now
infected easily.
cephalosporin has
Now
been
cephalosporin
given
has been
considering
given considering
which recurring school
which
exclusion would
recurring
be
school
appropriate.
exclusion would be appropriate.
So this is a
So this
school
is a
exclusion
school
related question.
exclusion related
Now our final
question.
answer would
Now our
be in
final
this
answer would
cases.
be in this cases.
It's nothing related
It's
to
nothing related to
antibiotic course actually.
antibiotic course actually.
Okay.
Okay.
So exclude the child from the
So
school
exclude the child
until the
from the
lesion
school
is
until the
completely
lesion is
healed.
completely healed.
Okay. If you remember,
If you remember,
we do have this chart.
we do
Has
have this
anyone
chart.
read this
Has
chart
anyone
before,
read this
guys?
chart before, guys?
Has anyone seen? So you have
Has
to also
anyone seen? So
remember
you have
not
to
only
also
just
remember not only just
apply, but you also have
apply,
to
but
think.
you
So
also have to think.
impetigo,
So impetigo,
exclude until
exclude
appropriate
until
antibiotic
appropriate
has
antibiotic
commenced.
has commenced.
Okay.
Okay.
So this is
So
different,
this is different, like complete of
and
antibiotic course,
comments of
and
antibiotic
comments
is
of
not the same.
antibiotic is not the same.
So not one, of course.
So not one, of course. So C4 is wrong answer. Still, I think three because certain answers are available. That till the crust got dried up, till the nations are gone. If you search more references, more advanced, not only that particular text, one of them you will find molluscum contagiosa. It's written in that particular that no school exclusion necessary, no exclusion, but more advanced searching you will find that if this option is not there, then options also available like this. Not Google like RSVGP, RCH guidelines, Australian immunization handbooks, many other references regarding Australian guidelines. Now, in advanced searches, you will find, and my word advanced search means more advanced looking into books I need to say. Okay, so you will find till the crust are dried up. So first thing, no illustration needed. Then more update came up that till the crust are dried up. Now in the third, another one now it is coming into the exam that they didn't mention any of this, but they're mentioning another point that do not use any swimming pool. But and we check the John Mutta, it was given somewhere in the John Mutta. So the molecular contagion thing can be contaminated through the water as well. So do not use the shared race or do not use the same swimming pool and this that. So that particular statement was correct. That is a fraction of one of the questions. Please understand, MC is a difficult exam. They can ask many advanced things. So when I say the molluscum contagiosum, you need to know everything regarding that in the university. It's not only always the lecture because up to lecture, probably they have made the question, but the advanced one they're making. Understand that one, and that might be waiting for you. Next one. Child patient respiratory irritation symptom of rheumatic heart disease with arthritis, murmur fever. How to confirm? I mean, this is secondary rheumatic fever. Confirming by definitely an isotiter. Easy one. Isotiter. It was almost about to end. All right. In 18 months with a tonic clonic seizure, I start with next day with a seizure related thing in the next class. Epilepsy. Seizure is our first epilepsy and the genetic that I will start in Sunday. Control with lorazepam. Very important in seizure cases, whether it is control or not control. If control with what? Very important. Check the scenaries and check the lab. Please come up for an answer. I can see that very clearly. The sodium level is pretty low. Its sodium level and this that thing is low, so that is enough for having these seizures and this that. But how do you confirm the further diagnosis in a cases like this? Okay, so I think further we can go for a lumbar puncture if because the person is also having confusion. Confusion, then vomiting. So this probably is a possibility, maybe an indication towards like serious disorder that should not be missed. That is the rule you are asking. Serious disorder like meningitis and this that's something you should not be missed because the person also have fever. Seizure, possibility meningitis. So we can do lumbar puncture here for a further confirmation. Okay. Seizure related, we do have a second note as well. I think this one is a child with a umbilical hernia. I think it's irritable child. I think we saw that irritable child referred to emergency. Okay, another brand new question. Just yesterday collected child with a nephrotic syndrome treated with steroid. Level of hypertension. Diffuse abdominal pain, vomiting for 1 week, and A fever. What is the cause? So a lot of things out coming here. So what do you think, everyone? Okay, this one is a new question. So we are also trying in a phase of building this question. Not fully sure it's. Yeah, I mean, I wish peritonitis would have been there. Yeah, yeah. It's a very new question. We're trying to also develop, this question. Yeah, nowadays. So we picked up pancreatitis. Just have a look on the answer. Yeah. So I think for me nothing is fitting. So have a look on the explanation. Let us keep it as a one, but it can be three as well. So I'm holding here for a second. Yeah. So looks to me in a weird question. I'm not really very sure about this question actually. Need to yes. As I said, it's a possible medicine induced pancreatitis. Okay. Drug induced, you see, among the pancreatitis causes, that is drug cause is one of the documented one. So that's one of like so far. But as you mentioned, this question is under construction. But I need to also tell you guys about this type of questions because see, exam is going on, and maybe last day of the exam of the current month is 19. By the time 19th, I think more better version of the question maybe we can receive from them. That's how we know we make the better ones actually. Okay. So I think we need the full form of the question. So far we picked up as a maybe drug induced pancreatitis, but if there will be any more updates, we'll be reposting this one. But exam is ongoing. Just third day has crossed. 2 more days left for this month's particular exam. So I think we'll get a more better version of this question soon. Okay. I think last question today. 4-year boy brought to the clinic because of difficulty running climbing stairs. Climbing stairs means it's a proximal muscle myopathy. Proximal myopathy, if you remember, there's some kids who does not have power, so they hold their own body and they get up. Okay, very interesting. I'm not sure you have seen this kind of cases in your life. We often mention this one as a Gower sign. Has anyone seen
this type of kids.
this type of kids.
And we name this one
And
as
we
a
name this one as a
proximal muscle weakness
proximal
or
muscle weakness or
Duchenne muscular
Duchenne
dystrophy.
muscular
Duchenne
dystrophy.
muscular dystrophy.
Duchenne
Fate
muscular
is not
dystrophy. Fate is
that
not
good,
that good,
honestly. So Duchenne
honestly.
muscular
So Duchenne
dystrophy, as you
muscular
can see,
dystrophy, as you can
they're
see, they're
primarily their shoulder
primarily their
girdle,
shoulder
the proximal
girdle, the
muscle, which is
proximal
quite
muscle,
weak.
which is quite
That's why
weak.
they're trying
That's why
to
they're
hold
trying
their
to
own
hold their
body
own
to get
body
up. You can
to
see in
get up. You
YouTube,
can
there's so
see in
many
YouTube,
videos
there's so many
available
videos available
with the cover
with the
maneuver.
cover
Just
maneuver.
have a
Just
look one time,
have
you'll
a look
understand
one time, you'll
immediately.
understand immediately.
Okay, so
Okay,
cover
so
maneuver to
cover
chinning, we
maneuver to
find those
chinning, we
patients
find
actually.
those patients actually.
Okay. It's
Okay,
because
it's because
that particular
that
gene,
particular
dystrophin,
gene
which is related to
dystrophin,
our
which is
skeletal
related to our
muscle,
skeletal
is
muscle,
bit
is
dilated.
bit
So of course,
dilated.
your
So
skeletal
of course,
muscle,
your
especially the
skeletal muscle,
proximal
especially
muscle,
the proximal
is quite
muscle,
weak.
is quite weak.
Give me some example of
Give
the
me some
proximal
example of
muscle,
the proximal
and of
muscle,
course, getting up
and
from
of
a
course, getting
chair,
up from a
right?
chair, right?
Combing the hair, which
Combing the
girls
hair,
do, I
which
think,
girls
100
do, I
times a
think,
day,
100 times a day,
right?
right?
Yeah. So
Yeah. So
you wash something and
you
put
wash
into the
something and
hanger.
put
So
into
these
the
are
hanger. So
examples
these
of
are
proximal
examples
muscle.
of proximal muscle.
Yeah.
Yeah.
So not like a
So
polymyalgia
not like a
rheumatica, which is
polymyalgia
common
rheumatoid,
in
which is common in
50 plus.
50
But this is
plus,
a
but this is a
the other case actually.
the other case
This is the
actually.
other case
This is
actually.
the other case actually.
All right.
Right?
In kids' cases, a
In kids'
proximal
cases, a
muscle
proximal muscle
issue is the
issue
Duchenne
is
muscular
the Duchenne
dystrophy. In
muscular
adult
dystrophy.
version,
In
three
adult
conditions
version,
we
three
discussed
conditions we
in
discussed
dermatology,
in dermatology,
um,
um,
polymyositis,
polymyositis,
polymyalgia rheumatica,
polymyalgia
and drug
rheumatica, and
response.
drug response.
Right.
Right.
So thank you so much,
So thank you so
everyone.
much,
Good luck.
everyone. Good
Thank you
luck.
so much for
Thank you
joining
so much for joining
the session. I'll be
the
posting
session.
the
I'll be
record,
posting the record,
and I wish you
and
good luck.
I wish you good luck.
Pediatric 01, we
Pediatric
posted
01, we
the audio
posted the
version.
audio version.
I think one,
I
two people
think
reported
one, two
they
people reported
couldn't play
they
it.
couldn't
It's
play it.
easy. Either play
It's
with a
easy, either
laptop,
play
maybe
with a
directly
laptop, maybe
play, or
directly play,
maybe
or
in the mobile app.
maybe in
You
the
know, you
mobile
just
app.
need to
You just need to
download SoundCloud
download
maybe one time.
SoundCloud
It's
maybe
a
one
popular
time.
app.
It's a
We used
popular
to
app.
also, I
We
mean,
used to
even till
also,
date, I listen to
even
the
till date,
music
I
actually.
listen to the music actually.
Yeah, yes, yes.
Yeah, yes, yes.
Yeah, there will be class on the
Yeah, there
Sunday,
will be
my dear.
class on the Sunday, my dear.
All right. I'll
All
update
right.
you guys
I'll
very
update you
shortly on
guys
that.
very
Okay,
shortly on
thank you.
that. Okay, thank you.
Yeah, we already shared
Yeah,
the
we
audio
already
version.
shared
It's
the
a
audio
couple of
version. It's
Thank you.
Thank you.
Okay, so should I
Okay,
start
so should
or
I
there are
start
more
or
people
there are
joining
more
in?
people joining in?
Yeah, there will be more people joining
There
in.
will be more people joining in.
You can start after two
You can
minutes.
start
Yeah.
after 2 minutes.
Let them
Yeah.
join first.
Let them
And
join first, and
yeah, no worries.
no worries.
Hello everyone, can
Hello
any one of you
everyone, can
speak
any one of
so
you
that I
speak
can know
so
that
that I
everything
can
is
know that
good
everything
and
is
I can
good
start?
and I can start?
Hello, hi doctor.
Hello, hi doctor.
Everything is
Everything is